Since I've just started recording, I'll restate some of the things I've just been saying to those of you who join me. Most importantly, welcome to the PreMed Summit, and welcome to the online component of the PreMed Summit. And the official portion of the summit will be starting in approximately 10 minutes with the land acknowledgement and introduction, and then continuing on to welcomes and introductions and information from the Dean of the College of Health, from the Director of the Medical Program here in Alaska, Alaska WWAMI, and from the Director of Admissions, the person responsible for overseeing admissions to our medical school, Stella Yee from University of Washington School of Medicine. We'll then continue with a short break. We'll have a guest speaker talking about how to turn your dreams into reality. And then we'll go to a question and answer session. And that'll just be us, just the online people, just me and you and me. If I could introduce myself, I am one of our two, what's the word for it? One of our two faculty pre-medical advisors here. Shannon Affenbeck's the other. We're always available for appointments. You can meet with us during Zoom if you go to the University of Alaska Anchorage website and look for pre-medical advisors. There are links to calendars for both myself and Dr. Affenbeck, and you're welcome, if there is a free spot, just simply to book it and talk to us outside the summit. But today, we will have the various speakers I mentioned to start with. We'll have the question and answer session, and then we'll have speakers this afternoon where you'll also have a walkthrough of the advising tables that are here. My colleague, Elida van Almelo, will be leading that. And there'll be various panels where you can meet with undergraduates and medical students. Now, throughout all of this, again, it's one of the challenges to be one of the online participants in something that's both online and in person. If during the presentations you have questions, simply type them in the chat. Obviously, when it's a Zoom session with just us, we can chat normally, or as chat as normally as Zoom will allow us. But if you have any of the presentations today, if you have questions, put them in the chat, and at an appropriate point, probably at the end of the presentation, I'll be asked if there are questions in the chat, and I'll be reading those through. So your questions will get answered at the end of the relevant presentation. On that note, I guess we have a few minutes before we start. Does anyone online have any questions for me before we begin? Yeah, it looks like we have one person joining. Okay, and we guess if there aren't any questions, I can preempt some of the material we're going to be getting today. So again, the purpose of today, this is to introduce you, or really to help you, provide an overview of our medical school and what's on offer here, provide advice on how to prepare yourself, depending on the level you're at, for medical school, and also establish those contacts. So it's just some strange acronym in the distance, and also maybe clear some things up. So the whole, what is Alaska WWAMI? What's the connection between UAA and University of Washington that makes this medical school possible? What's it like being a medical student? We have some medical students here today for one of the groups. What's it like being an undergraduate student if you happen to go to UAA as your pathway to medical school? You don't have to go to UAA. As long as you're an Alaska resident, it doesn't matter where you go to college. We're going to treat all our applicants equally. But if you do go to UAA, obviously we're here on campus as a resource, and there'll be some students here to talk about that. Obviously, for those of you who are at high school, what possibilities are available to help facilitate your journey so that you can do the right things at high school, to set yourself up to doing the right things as an undergraduate, to set yourself up to do the right things as an applicant for medical school, to successfully entering medical school and doing well. And also then beyond that, what is medical school and what does that mean? Is that the end of the process, or given if you go online and you get information about this pathway, it can be very confusing. What are these things called residencies? How long do I have to be at school? How much does it cost? We're always very shy about that, but you can ask. So hopefully we'll get those questions answered for you today, and also help some of you make contacts, whether that's with myself and Dr. Affenbeck as advisors, or with undergraduate or medical students or the admissions staff here, so that you're able to basically pick up from today and continue your journey. Again, we have about 5 minutes until the official start of the presentation. Does anybody have any questions now? I see we've got about 2 or 3 new people join us online. Just checking. And actually, perhaps we could just have a show of hands, as we've got a couple of minutes. If you are currently an undergraduate student, do you want to use the React button on Zoom just to put your hand up so I'll know who's a current undergraduate? Just put your hand up using React. Okay, so Cedric and Ilan. Okay. You can put your hands down. Who's currently a high school student? Okay. Looks like I'm going to assume it's Adelia. It's always difficult to get names pulled off from the internet, so thank you. Okay, and Julie. And is there someone here? Are there any people here who are teachers or parents? Okay. I don't see anybody at least admitting to being a teacher or a parent online. Okay, but it's nice to see that we have a group. We've got some undergrads, we've got some high school students, we've got some people who are probably getting their coffee and getting ready for the day. Okay, now main part of the program will start in 3 to 4 minutes. Kent, I can see you online. Did you have a question you wanted to ask?
No, I just want to say I'm a grandparent.
A grandparent, okay. I missed a category. I feel very sorry for snubbing you there. Okay. Well, welcome to the online Zoom session, and I hope we provide you with the information that you need to appropriately mentor your grandson or granddaughter.
It's a grandson who is attending U of A.
U of A. Okay. In Anchorage or Fairbanks or Juneau?
In Anchorage. In Anchorage.
Okay. Well, I'm glad they delegated. I'm glad you got delegated. I hope you find the day interesting, and I hope they appreciate you helping out.
I hope so.
Okay, and I see I've got also a parent of 2 high schoolers. Okay, so we do have a mixture. We've got multiple people, we've got multiple parents and grandparents, multiple high school students, and multiple undergrads. So we have designed the day, so it will have information for all of you. And again, just feel free to ask questions as the day goes through. And during the main presentation, or during the combined presentations, please do that using the chat. And then when it's just us at 11:15, we'll talk normally.
Hi, Ivan. I was wondering,
Hi,
do you
Erin.
see
Yes.
an increase in the number of people doing gap years? I'm post-bac, but I'm a couple years out from school to the point where now I'm wondering if I might be considered a non-traditional student or not. I graduated in 2021 from college.
Okay, that's a good question. We don't, I mean, again, we don't discriminate against or for non-traditional students. I think our typical class intake is pretty much an even mixture of traditional and non-traditional students. Possibly because we're an Alaskan program, it's very common. Certainly the age range that we see in the incoming class tends to vary from low and mid 20s, the people who've gone the traditional route, through into mid 30s, 40s, early 40s. I'd say the average age is probably high 20s, low 30s. So we should speak more when we have more time during the advising session. But certainly taking a gap to strengthen your application, if that's doing a post-bac or similar, is absolutely appropriate and normal, and would be seen as viewed positively as a way of strengthening yourself as a candidate. There are some challenges with just taking a gap year for the sake of a gap year in terms of Alaskan eligibility. But I guess as it's now 8:59, I'm going to get booted in about a minute for somebody else. We'll remember that and have a talk. So thanks for raising that, Erin.
Yep.
And of course, me saying that I'm going to get booted at 9 is me optimistically assuming that everything's set up correctly in the lecture theatre. I'm also at a distance today. I'm not physically in Anchorage, despite my Anchorage background to my picture. I'm returning to Anchorage in a few weeks, but I can't see what's happening in the lecture hall. So I'm just going to assume they're going to take it away in a minute or two. Okay. And just looking in the chat, Erin, you're not the only non-traditional student, but Aliyah saying that she's a non-traditional recent grad. So there's, you're certainly not alone in taking a little bit longer or a slightly different path to going to medical school. Okay, I just got a message that will be starting in about 20 seconds. So probably pretty much now. I think here we go.
I'm good. I'm going to get us early. Yeah. Gosh. Let's get rid of all of that. Okay. Good morning, everyone, and welcome to the Pre-Med Summit. My name is Dr. Kathy Young. I'm a family practice doc, and I'm also the assistant dean for the Alaska WWAMI program, both at the University of Washington School of Medicine and at the University of Alaska Anchorage. So I'd just like to extend a very warm welcome to all of you. Thank you for coming out so early on a Saturday morning. We really appreciate it, and we're excited to share what both the College of Health and what Alaska WWAMI can offer folks who are interested in careers in medicine. With that said, I'd like to acknowledge the University of Alaska Anchorage and the Health Sciences Building, and many of the clinical sites that we have students participate in are seated on the traditional lands of not only the Athabascan, but many of the nations throughout Alaska. And we appreciate looking around at the beautiful landscape and scenery, all of the work that they have put in through generations and continue to put in. The program for this morning is going to be pretty fast paced. If you have not already found your little blue sheet, I would encourage you to take a look at it. I'm not going to talk for very long here. You're going to hear from Dr. Debbie Craig, who is Dean of the College of Health. And then I'm going to talk a little bit about Alaska WWAMI specifically as a medical school and what the opportunities and offerings are. Stella Yee is here from the admissions department at the University of Washington, and all admissions to Alaska WWAMI come through the University of Washington. So she could give you a lot of information about what a successful applicant looks like and how to work through the admissions process. After that, we're going to give you the opportunity to pick one of 3 breakout sessions. We'll then have lunch in the lobby, and then there will be the opportunity to pick 2 more breakout sessions after lunch. And we're gonna wrap up around about 2:40 after the keynote speaker, who is Dr. Bridget Mayorga, Dr. Lisa Nash, Dr. Kristen Stokler, and Dr. Monica Wright, who's actually, remember, entering class of 2011 WWAMI graduate, and she's now a family practice doc here in Anchorage. I think it will be well worth your while hanging around to hear the input from some of those speakers. So without any further ado, I'll give you Dr. Debbie Craig.
Good morning, everyone. I love being here on this morning, especially even though it's a weekend, to see all the bright, shiny, eager faces in the crowd. Those of you that are students, raise your hand, or potential students in the future. And those of you that are parents. Okay, awesome. I want to give a shout out to the parents. You have very excited, driven children, and it takes devoted parents to get your kids here. And so I greatly appreciate all that you do to support your kids. And all of you students, boy, we have a need in the state. We have, in the College of Health, we have over 50 degree health programs. And there's a workforce need in every single one of them in almost every community in the state. So we need you. We need all of you in many, many different professions. So we are here. That's really why we have this summit today, so that we can give you all of the material that you can possibly have to have a successful application into some of our programs. With that, 3 of our programs that you may be interested in are graduate programs. Certainly WWAMI School of Medical Education that Dr. Young oversees. And then we have our Physician Assistant program, which is also a University of Washington partnership. And it's called the WWAMI MEDEX program, or that's it. I'm sorry, the UW MEDEX program. MEDEX, it was an anomaly to me at first. I'm like, oh, that's a physician assistant program. So that is a graduate program. Also, we have that need all across the state. And then thirdly, we have our pharmacy doctorate program, and that is in partnership with Idaho State University also. And we have a significant need all across the state for pharmacists too, pretty much everything. I'll just add that as a tagline to all of our programs. That said, today we have outlined many different pathways into our programs. To get to those graduate programs, you typically need an undergraduate degree first. And we have a lot of things in the College of Health that you can do to help prepare you for that WWAMI application and that your trip towards medical school or PA school or pharmacy school. So we have, for example, we have a bachelor's degree in health sciences that has a pre-professional track. And those classes are specifically designed to meet all of the prereqs of all 3 of those programs. I'm going to look at Kathy to give me a nod on that. So that's one of our most popular undergrad degrees for students that are interested in those 3 graduate programs. We also have some shorter programs, or programs, our medical assisting program. I'll give you an idea. So medical assistants work in physicians' offices and they help their physicians in patient care. The need in the state for the estimated need for medical assistants was annually, we have 684 openings. That seems exact, but that's, we do these workforce analyses all the time. And to let you know, we graduate at UAA, we graduate between 12 and 20 per year. So we have a lot of room to grow. We have every community in the state that needs medical assistance also. And that is an AAF. So you can get that on the way to medical school. If that's what you want to do. We also have phlebotomy. We have an NPH program. So those of you that may already have a bachelor's degree but are finishing some prereqs, our master's in public health program is a combo that many physicians in our state have. So it marries public health with medicine. And so that's a popular program also. And that's all online. You can do that from anywhere in the state. And then we have several, again, phlebotomy, medical office coding. We have another undergrad degree that is medical laboratory science. How many of you watch NCIS or CSI? Those lab people that do all the forensics testing, that's medical laboratory science. So it's kind of fun to think of it that way. And that's a really fantastic degree that has some room to grow also. And we have, we're the only program in the state for that, so you can imagine the need, and that is really prepares you to do all of the analysis to detect diseases in patients across the state. So with that, that's kind of an overview of the multitude of things that you can do. We have a physical therapy assistant program, we have a pharmacy tech program. That you can get on the way to getting into the pharmacy program. There's a myriad of things, and you'll find out about a lot of those today also. So with that, I'm gonna step aside and let the learning begin. I have to say one more thing. It's so beautiful to see such a diverse crowd here today. We value diversity a great deal, and we want every single person, every human, regardless of any skin color or anything else. We appreciate your diversity and we welcome you into our college. All right, thank you.
Thank you, Dean Craig. And yes, there are a lot of options within the College of Health, and there are a lot of options within the UA system, and particularly within the College of Health at UAA, as you consider careers in medicine, and particularly consider looking at becoming a physician. So the WWAMI School of Medical Education was started actually up in Fairbanks in 1971. This is a program that is more than 50 years old. And started with 5 students, rapidly went to 10 students, moved down, I believe in the 80s to UAA, and has expanded from 10 to 20. And we are slowly in the process of building out from 20 to 25, and then hopefully 30 this year. So we are also very interested in making sure that we have enough qualified, exceptional candidates, hence opening up the offers of how do you build your career and application so that you're successful coming in. And I would encourage you to take a look at the College of Health here in state as one of the many options of entering medical school with us. Now, if I can get this to go forward. The medical school is primarily established in the health sciences building at the moment. This is our entering class of 2024. The health sciences building, it was purpose built and opened in 2011. we have a classroom there. There are 3 simulation labs there. There is a physical exam space there. So all the pieces that we need to get you started. As we expand the Sally Monserud building, which is not very far from here, it's right over there beside the Wendy Williamson, has been completely refurbished. Not only will WWAMI be in there, but so will the ultrasound tech programs, the OR tech program, and CNA. Thank you. I'm forgetting somebody. The CNA program will also be in there. So you'll have the opportunity to work with some of the other students in the program as well. So when we talk about becoming a physician, just to make things crystal clear, you come into medical school with a bachelor's degree of some description. And realistically, WWAMI has always said, we don't really care what your undergraduate degree is in. We have taken people with undergraduate degrees in language. We have taken folks with undergraduate degrees in music. We have taken engineers, we've taken nurses, PAs, and the more traditional, I did basic sciences before I came in. You do need to complete the prerequisites. Otherwise, you are setting yourself up for failure in the first year. So make sure that you have your genetics and organic chemistry and biochemistry under your belt. And our pre-med advisors will tell you and go through specifically what courses you need to have under your belts before you hit that first course. Because medical school is very, very fast-paced. And that's the reality of it. So the first 4 years are medical school. And then what happens after that is physicians will go on to do specialty training. So if you're going to do family medicine, general pediatrics, general internal medicine, something along those lines, you're going to do an additional 3 years. If you want to do family medicine and do cesarean sections and deliver babies, you're probably going to do a fellowship or an additional year. If you're going to do a specialty in pediatrics like gastroenterology, so you want to see sick kids primarily with stomach problems, you're probably going to do an additional year beyond that. So residency and fellowship can be anywhere from 3 to 7 years. The folks who wind up 7 years in residency, those are the neurosurgeons, the cardiothoracic surgeons, some of those folks. And then we look for people to come back to practice. The one thing that I need to be crystal clear about when it comes to WWAMI is we are looking for folks to come back and practice in Alaska. If you don't want to come back and practice in Alaska, this is probably not the medical school for you because there are much cheaper options all over the lower 48. There is a payback requirement in service, which is 3 years in a rural area or 5 years in an urban area, or a very large chunk of change, which you will pay back to the state of Alaska. The contract is between you and the state of Alaska. It is not between you and UAA. Is not between you and the WWAMI program. So we are looking for folk who are going to come back and practice in Alaska. The WWAMI program through the University of Washington School of Medicine is a little bit different than some of the other programs. It is divided into 3 blocks. The first piece is what we call foundations. The second piece is what we call patient care. And the third piece, which is a little longer than some of the other programs or some of the other medical schools, is what we call explore and focus. And that's really your 4th year. It allows you the opportunity of doing some other pieces to confirm your choices for residency. What is unique is we get very early clinical experience. So we start our class in July of their first year. In September, we do a clinical boot camp where we teach everybody how to do a history and physical. And then basically you are into the hospitals 1 half day a week after that. And the clinical training continues throughout the foundations phase. So that when you get to the clinical or the patient care phase or clerkship phase, you're ready to go. You're not trying to learn how to do a history and physical. You're not trying to learn how to communicate with patients. You already have those pieces under your belt. And now it's time to learn how to apply everything that we taught you in the first 18 months. We do a lot of active learning. So the curriculum is available online. The resources are available online. You are expected to come to class having at least taken a look at the material, because what we're going to do in class is start to apply it. There's a lot of small group learning. There's a lot of self-directed learning. Your graduate students, we expect you to take responsibility for your learning and move forward with it. We also recognize that our students are adults. Many of them have had careers beforehand. Many of them have kids and family, and there's a lot of balancing that needs to go on with that. And so we need folks to come in prepared to class. You're only in class for 4 hours, not 6 to 8 hours. But we do expect people to show up for class because the learning is much more effective when people are in groups. And COVID, if it showed us nothing else, showed us that people learn much better when they're focused together and in person. So, as I said, we start early with the clinical piece. Every student is assigned a physician mentor when they come in small groups of 5 or maybe 6. That physician will follow them throughout their 4 years in medical school. For the first 2 years, you'll see that person pretty much every other week in the hospital at bedside, taking patient histories, doing physical exams, and learning how to be a physician at bedside. After the first 18 months, when you're out in your own patient care phase and beyond, that person usually stays in touch with you through phone calls or texts or email, and sort of watches how you're doing clinically, and gives you feedback. They're there if you have questions or concerns, you're not sure if this is going the way it should be. You're not sure what specialty you want to do. This is a person to start with for a discussion, to find other resources and so forth. They do not need to be your only mentor. They're just a starting point. This is what the starting curriculum looks like. And this is why I'm like, you have to have your genetics and cell phys and biochem and epi-biostats under your belts, because you're going to cover everything that you did in undergrad in about 9 weeks. Don't sneeze, you'll miss something. Plus, we're going to throw some anatomy and pathology and histology and pharmacology in there. And we're going to talk about some of the societal things that are important when you think about how you're going to deliver medicine, and how do you deliver medicine in a state like Alaska, which is very big, doesn't have a lot of roads, and healthcare systems and how they work are a little bit different here than they are where you can just get in the car and drive. We do a clinical immersion, and then we start marching through each of the systems. So you do infections and immunity, cancer, hormone, and blood, which is exactly what it says it is. Then we get into everything orthopedic and rheumatology and dermatology. Then you do cardiac. Then you do pulmonary and renal. And then you finish up the first year with head, neck, and gut. It's a lot. It's 11 months. You need to pace yourself. We do have a couple of weeks in there which are a little bit lighter, but not many. And they're really to give you an opportunity to sort of integrate some of the information that you have. Between first and second year, we provide an opportunity for folk to look at research opportunities, be these in rural communities, which is our rural underserved opportunities, or be they scholarship of discovery or integration. Or there is a competitive opportunity to do global health. That is competitive across all of UW, and our students, we usually have 1 or 2 who go every year. You come back to us for the fall of your second semester, finishing out neurology, psychiatry, and then OBGYN and peds, get a quick look in. After that, you have about 2 months to revise all of that information and review it and write your first licensing exam, which is step 1. And we expect people to complete that by March 1st of their second year. After that, you move into clerkships, and our clerkships are typically 6 weeks. Many medical schools do 4. We do 6 because we think it takes that long to really consolidate and get people up to speed and learn the information to be effective physicians. The core clerkships are listed here. They're family medicine, internal medicine, general surgery, OBGYN, peds, and psychiatry. These clerkships can be done anywhere within the WWAMI region. So they could be done in Washington. They could be done in Wyoming. They could be done in Montana. They can be done in Alaska. What typically happens is if you choose to do the WWAMI experience, what's going to happen is you're going to pack your bags up and you're going to spend 6 weeks in Sitka doing family medicine. And then you're going to go do 6 weeks in Juneau and do psychiatry. And then you're going to go to Washington and do 6 weeks and do peds at Children's or something along those lines. So you're going to be moving every 6 weeks. Something to think about as you think about what kind of medical school you want to go to. I think it is a great way to learn medicine, because not only do you get to see how medicine is delivered within the state of Alaska, which is very unique, but you also get to see how your colleagues in other states have taken the same information and the same guidelines and the same protocols and applied it to their individual communities, be they big urban centers like Seattle, big teaching hospitals like the University of Washington, or small rural communities such as we find in Western Washington and Wyoming. And the take on how you deliver medicine is very variable depending on the community needs. And I think this is an important thought to keep in mind as you move forward in considering your options in medicine. What works in Cox Butte and what works in Harborview in Seattle are vastly different. So anyway, the other options that are currently available is you can choose to track in Alaska. So you can choose to say, I want to spend most of my time in Alaska, and most of, but not all of your clerkships will be in Alaska. You are required to spend 12 weeks at the University of Washington School of Medicine at either Montlake or Harborview, but one of the big teaching hospitals. And that's so that you get an understanding of what an academic teaching center is like, because guess what? When you're a practicing physician, you're going to be sending your patients there. And you need to understand what their, or have an idea what their experience is going to be. Otherwise, you're not going to be very effective in managing their care when they come back. You can also choose to spend the vast majority of your time down in Olympia in Washington in what we call a longitudinal integrated program. You can also do RIGHT, which is a more longitudinal program within Alaska, and we have 2 or 3 RIGHT sites every year. Soldotna, Juneau, Kodiak, Matsu tend to be the ones that we have up and going at the moment. And Dr. Doty, who is not here today, is working on developing others. 4th year, like I said, 4th year is a little bit longer. It starts in March of the 3rd year and runs through May of your final year. You are required to do 2 clerkships, emergency medicine and neurology or neurosurgery, depending on where your interests lie. And then you are required to do an advanced patient care and a sub-I. The rest of the time is sort of open for you to choose to do what you want to do. So I have had one student who desperately wanted to do orthopedics and I think did 5 away rotations at other institutions to figure out where he wanted to do his orthopedic training. That's a lot and not usually recommended, but you have the opportunity to go and check out a different university system if that's what you want to do. You have the opportunity to stay in Alaska. You have the opportunity to stay in Seattle. You have the opportunity to sort of have a lot more flexibility. So if you know you want to do pediatrics, you can pick to do a bunch of pediatric rotations in the areas where you think would be most helpful. And then you graduate and people tell me, well, it's 4 years, it's a really long time. It's not, it's really fast. Talk to some of our students about how fast it goes. You will be applying for residency and graduating and moving off to your residencies faster than you can imagine. We also have opportunities that we call pathways. These are additional curricular opportunities. So these are not required. So if you have an interest in providing care to the underserved populations, if you have interest in providing care to the Alaska Native American Indian population, these are additional pathways. What they are is a series of online modules that you can take a look at. And then they're in the clerkship phases are required clerkships in some of these areas that give you a little bit more experience and hands-on practical experience learning how to work within these populations. There is also a research pathway that also starts in first year. And if you're interested in doing that, you sign up to do that. Again, we have actually in-person classes here because we've had such high demand. And Dr. Holly Martinson will talk to you about that a little bit later. But if you're interested in research, we are interested in developing physician scientists as well. This is separate from the MD PhD program, which is a whole different piece. We also think it's really important to give back to communities. We learn from the communities. Community providers provide a lot of education with very little or no reimbursement. And so there are lots of service learning opportunities. These are student driven. These are not driven by the University of Washington. They are driven by the students. They are overseen by the university. And so we have clinical opportunities, we have advocacy opportunities, and we have educational opportunities. So it can be everything from going out and talking to high school students about how you got into medicine, to working at Brother Francis Foot Clinic, to volunteering with 4As, to do HIV and Hep C testing as an outreach. Talked about that. Interprofessional, obviously the College of Health has lots and lots of programs. Spoiler alert, physicians don't work on their own. We could never manage that. So you are going to be working with your colleagues from across multiple other programs. So as a practicing physician, I have a medical assistant, we have front office people. I'm going to send people down the road to the lab. They're going to have a phlebotomist draw their blood. I'm going to send them for x-rays. The x-ray tech is going to get them back and get the x-ray done. I write, unfortunately, more prescriptions than I like. But my pharmacy colleagues are going to take a look at the medication, take a look at the medication lists, make sure that we're not doing anything crazy. Many of us have worked or continue to work with physician assistants to help manage the patient loads. The purpose of the interprofessional opportunities is to get you engaged with your colleagues so that you know how to interact with them when you're out in practice. or when you get to clerkship, because guess what? You're gonna run into all of these folk when you're in clerkship, in patient care phase. The foundations faculty, we have a fairly sizable faculty, both PhD and MD here at the foundation site. We also have a huge number of volunteer faculty, particularly the primary care physicians. So in your first year, you will be sent out to a clinic. Those physicians will take you for a half day a week, give you opportunities to practice some of your clinical skills and learn from their patients. They are unpaid. The clerkship faculty obviously provide a huge amount of education. So the faculty is more than just who you see at UAA. That is just the tip of the iceberg. We have smaller class sizes. Yes, we're going to 30, but that is still a small class size by medical school standards. Spokane has 60, Idaho has 40, correct me if I'm wrong. Seattle has 100 students. If you come to Alaska WWAMI, the faculty are gonna know your name. They're gonna know who you are. And we are totally behind you 100%. We want to see our students succeed. These are precious places. We need physicians and we want to see people succeed, and we will do whatever it takes to try and get you through. The other part of that is we need your hard work. We need you to show up, and we need you to show up prepared. But the faculty is dedicated to getting their students through. I'm not going to touch a lot on this because Stella Yee is going to touch a lot on this, but basically you have to be an Alaska resident, and I will talk a little bit about that. You have to have a bachelor's degree, and there are prerequisites that are required. What are we looking for? We need folk who have the academic ability to complete the medical training. I can't do anything about getting you through medical school if you cannot pass the licensing exam. So you have to have that minimum academic ability. You have to have sufficient knowledge of the practice of medicine to know what you're getting yourself in for. There is nothing that breaks my heart more than somebody who comes to me after 18 months and goes, this isn't really what I wanted to do. You're on the hook for all of the costs, and you're on the hook already for the state of Alaska payback. So we really need people to know what they're getting into and to know that this is what they want to do. Good communication, good interpersonal skills. You have to be able to talk to patients. That's not an option. Having an awareness of what is going on in medicine, not only within the US, but a little bit internationally, is always a good idea. We need people who can problem solve. So that critical thinking piece is really important. And then broad interests and some life experience really helps. So getting out of your comfort, getting out of your bubble a little bit is also, I think, incredibly helpful for students, because patients are going to walk in. They're going to walk in bringing what they're bringing. And you have to have some way of meeting and building connections with them, no matter where they're coming from. This is the eligibility statute. This is not something that I get to choose or anybody else gets to choose. This is online. You can pull the statute up. But basically it says you have to have been physically present in the state of Alaska for 2 years prior to the year that you are applying, which is why it's so much easier if you are coming to the College of Health, because then you're in on one. Or if not physically present, then you have to meet one of these other criteria. Like I said, this is available online. It's in statute. It hasn't changed. We do have pre-med advisors. There's Dr. Ian Van Tetz and Dr. Shannon Uppenbeck. They are available to anybody who is an Alaska resident, whether you're going to school here or in Montana or in Idaho or in Washington. Please reach out and use them. They have counseled many, many students. They know what it takes to get into the WWAMI program. They are happy to schedule appointments and talk you through what you really need to do. And they'll be here today. And with that, I think I have 5 minutes for questions. Yeah.
Good morning, Dr. Young.
Good morning.
Two things. One, well, thank you so much for putting this on. This is a great resource. We don't get a lot around here. So thank you. Secondly, wondering if you could touch on kind of differentiating between MD and PA programs. We see this trend that undergrads that have been coming in are increasingly going to PA's programs, citing it's a shorter time training. They get to move around a little bit. Can you touch on where that scope overlap terminates and why somebody might choose an MD program over a PA pipeline?
Yeah, this is always a challenging piece. So the difference between MD and PA is physician's assistants get 2 years of training. There is no residency. The training they get beyond that is typically on the job training. MD is going to be, like I said, 4 years plus residency. Depending on the state, and that includes the state of Alaska at the moment, physician's assistants have to work under the license of a physician at this point. So depending on what their physician does, so if their physician happens to be an emergency room physician, then they're going to work in the emergency room. If their physician happens to be a cardiologist, they're probably going to work primarily in cardiology. The MDs, you can choose what specialty you want to go into, and we see people change their minds. So I think particularly within general internal medicine, within family medicine, within pediatrics, we see people find their own niche within medicine as well. And I think you have a lot more, this is my bias, I think you have a lot more independence within medicine or a medical degree to choose where you want to go, no matter where you are in your career. I started out as a family medicine physician after deciding pediatrics was not for me, and did general family medicine for years, and then had the opportunity to go and work primarily with the Medicare population. So I did 5 years of geriatrics. That is something that you, within something like family medicine or internal medicine, have the flexibility to do. And then have made the move more into academic medicine. But I think the MD degree gives you a huge amount of flexibility and opportunity. Physicians are also sought after for roles within pharmaceutical companies, as well as within administrations, as well as, I mean, you can take an MD degree and go anywhere, is basically part of it. The and this is something that we look for in applicants' essays. Why do you want the physician role? What is it about the leadership, the patient care, the strategic thinking that you want, as opposed to being a nurse or a PA or a pharmacist? Not that pharmacists don't have strategic thinking and not that PAs don't have strategic thinking, but it's a little bit different role. I'm not sure I fully answered your question.
That's great, thank you.
Okay. Other questions? Yeah.
Hi, Dr. Young. Earlier you mentioned that the materials for the medical school is open for the public. I was wondering.
It's not open for the public. It is online.
Okay.
So once people matriculate, the entire curriculum is online.
Okay.
Yeah, so I think there's one required textbook in foundations. The rest of it is all online.
Just to clarify, you have to be in medical school and then you get access to.
Yeah. Sorry. Yeah,
I'm wondering if you could expand a little bit more on the tuition agreement between the state of Alaska and the University of Washington and how that kind of fits in with options for public loan forgiveness, such as through an IAPS pathway. And if you're eligible for both public loan forgiveness through external pathways, if you plan to take the 3-year off the road system, 5 years on, and how much tuition forgiveness that really counts for.
so, that's a lot of questions. I'm not sure. I am happy to talk to you individually. It's a lot of questions. So ACPE are the people who oversee it. And if you Google them and go to their website, they have a whole 2 pages or 3 pages of frequently asked questions. Basically, there is a contract for the 2nd, 3rd, and 4th year. And the simplistic way of looking at it is that the state of Alaska covers the difference between out-of-state tuition and in-state tuition. So you continue to pay in-state tuition for the University of Washington as a medical student, and the state picks up the other half of it. So the state of Alaska doesn't care whether as far as I understand, the state of Alaska is not concerned about whether you're getting IHS loan repayment, as long as you're practicing in Alaska. They get to determine what they consider rural and what they consider urban. And this is not obviously based on the federal pieces that depending on which piece it is, says all of Alaska is rural. But if you do 3 years at 100% FTE, so a full-time job, they do mean 3 years rural and they do mean 5 years urban. And that's the 100% loan forgiveness for that piece that ACPE covers. It does not cover the tuition that you have to pay to the University of Washington as a medical student.
Can I ask a quick follow-up question?
Yes.
How subject to change is this program? You should say with changes like local and national political administrations. Is this something that's like semi-permanent and built into the structure of Alaska's like educational institutions, or is this something that we can see changing between administrations?
Never like to say never. This is an agreement between ACPE and the University of Washington. So it is not a federal agreement, if that helps. So it's state of Alaska and the University of Washington. So it would need to take one or both of them to change things.
Thank you.
Okay, I'm told that I have to end. I will be around all day. Feel free to come find me, and I'm happy to answer questions.
Probably escalating us behind, so I have. This is yours, right? Yeah. And I was yeah, I haven't done that. Let me share that. Okay. You're good with billing, right? Is it like he's talking about that?
All right.
Thank you.
Hi all, good morning. Thank you so much for spending the Saturday here. My name is Salini. I am the Director of Admissions for the University of Washington School of Medicine, also commonly known as the WWAMI program. So just an FYI, WWAMI and UW School of Medicine are used interchangeably. If you are a WWAMI student, you are a UW medical student. If you are a UW medical student, you are a WWAMI student, regardless of which state you're from. I do want to apologize. I got a cold at the beginning of this week, and so now I'm kind of at this tail end, kind of like part of it. So we'll roll with it. So I've been in my role for about over 10 years now. I pretty much oversee all of the administrative aspects of our admissions process, provide support for our admissions committee. We have to almost 200 people who are volunteering on our admissions committee to either interview and screen our applications. Within that larger committee, we actually have a subset of committee members called the executive committee. And these are the folks who are going to be reviewing applications, having the discussions, deciding who's going to be admitted, who's not going to be admitted, who's going to be admitted. So I provide support for them, as well as support for our Associate Dean for Admissions, Leanna Lucine, who is an alum of this program. So anyway, just to kind of give you a little bit of background, I've seen a lot. When I like to talk about the WWAMI program, I do want to talk about what are some of our commitments, things that we find very important. Let's see. We are committed to the states of Washington, Wyoming, Alaska, Montana, and Idaho, or WWAMI. We are your state medical school. So we have 25 going on 30 seats set aside just for Alaska residents. We're only considering Alaska residents for those seats. And we even have a separate alternate list so that if a position in the entering class opens up, we are going to take another Alaska resident to fill that. We're committed to training physicians of all specialties to practice in the region. But because so many of our population lives in very rural and remote areas with very few healthcare providers, as well as urban dense, population dense areas where they experience social and financial barriers to accessing care. We do recognize the special importance of primary care doctors. But that said, we need all doctors, period. We also know from surveying all of our incoming students that 75% of our students go into a completely different specialty than what they thought they were going to go into when they start medical school. So we figure you're going to change your mind. That's fine. For us, what's more important is how do you make that decision? And the process that you use to make the decision of what kind of doctor you're going to be is probably not going to change. We're also committed to training biomedical researchers and also providing educational opportunities for those who come from educationally and financially disadvantaged backgrounds. So with that, our admissions committee also created our own mission statement that says that we will use holistic review to select diverse and inclusive future physicians who share the values of our school. We will choose the next generation of leaders who will innovate to improve healthcare and health equity for all, especially the rural and underserved people of WWAMI. And with that mission statement and also our commitments, we come down to what do we look for our applicants? Well, we're ultimately looking for people who will help us meet our mission. If you're from Alaska, chances are, we hope you will be going back to Alaska to practice, so it helps us meet our mission. We want those who know what it means to be a doctor, what the realities are, not just all the positive things, but what are some of the things that can be really challenging. We want folks who understand the current issues facing medicine. We want people to be able to pass the classes as well as pass standardized tests. Folks who love problem solving, and also people who have good communication and interpersonal skills, because the reality is that you can be a subject matter expert, but if you come across it in a way that you are very arrogant and dismissive, or you use a whole bunch of research jargon, big letter words that folks don't really understand what you're saying, you're not going to be a very effective doctor. So we really want someone who can take very complex subject matter and explain it to folks who may not have that same background, like a fifth grader. And so that's our expectation for all of our applicants. And then for our non-WWAMI applicants, we will consider them if they have demonstrated an extensive service record with underserved communities, they come from a disadvantaged background, and they have ties to WWAMI. So that means they might have gone to high school in the WWAMI region, or they live in the WWAMI region, or they have family still in the WWAMI region. But those are things that we are considering when we're looking for our applicants. Now, a common question I get is, well, if I have a really high GPA, can I make up for the fact that I have no clinical experiences? Or if I am a very warm and great people person, does that make up for the fact that I have no volunteer experience whatsoever? The answer is no. What we really want is we want people who have all of these different pieces. And when we're going to make that decision, we're really going off of the information that you share with us in your application. So we need to be able to see it. And the other thing to keep in mind is that when we're looking at your application, we're really taking the things that you share with us, and we're really evaluating it and assessing it from the context of the rest of your application and also your lived experiences. So it's not a matter of if you do this and this and this, you're sure to get in, or if you do this for this amount of time, then you're golden. It's really about us taking a look at your application, your story, your experiences, thinking about it from the context of also your background and also your lived experiences, what opportunities you had available, and then from there making a prediction of how likely you are going to be able to make it through medical school and become a physician, and also what kind of physician you're going to be. The application process is long. Out of curiosity, who here is going to be applying in the next year? Excellent, excellent. 2 years? More than 2 years? I am so glad y'all are here. Honestly, I think with the application process, the best thing is just having the information and knowing what you need to do and to be able to prepare for it. So applying to medical school takes 1 year. Medical schools in general have a cohort admission system. So that means they take people once a year. This is very specific to the University of Washington. And I also want to say that all medical schools have their own deadlines. So make sure to do your research. We recommend that you take the MCAT before the end of September. We've changed our application deadlines for the upcoming application cycle. So everything has been moved up to 2 weeks, which is another way of saying, if you're going to be a couple of years out before applying, always check the websites for the schools that you're applying to make sure that the information that you have is correct and accurate. You have to send your ADCAS application in by October 1st. We will send you a secondary application as soon as we get your ADCAS, and then you would have until November 15th to get it in. We start interviewing applicants in October, and then generally we finish up by the end of February. I've also shown here, we have the interview week for the current application cycle. So that was all Alaska applicants were interviewed in the same week. And then we send out admissions offers from October 15th through the entire season. And all Alaska applicants get to know by, well, the next day after the last day of the interview week. Now, just because these are the deadlines, this is, September is the last, what do you think the MCAT, ADCAS, October, whatnot. These are really hard deadlines, and these are not the deadlines we should be working towards. In reality, you can start submitting your application to MCAS as early as June. You can start working on it in May. You can take the MCAT up to 3 years before you plan to start medical school. So there are going to be MCAT exam dates in January through September. We start sending out secondary applications in August. And so when we get to this part where we are interviewing, there are going to be folks who are still working on their application while we're already making offers into the class. Now, the thing to keep in mind as Alaska residents, This idea of this rolling admission process doesn't apply as much to y'all because no matter when you apply, you will be interviewing during this week and you will hear back with that decision. But since this whole long process is about becoming a doctor, I'm not necessarily going to one specific program, although I do want y'all to come to our program. Know that other medical schools are going to have rolling admissions. You want to make sure that you are putting your foot, putting, taking the best foot forward in regards to having your best. You want to have good options and chances for applying to multiple programs and be able to get multiple offers. And so for that reason, you're going to want to work with all the different deadlines of the different programs that you're applying to. So as I had mentioned, once you take the MCAT, you want to take the MCAT within 3 years before you plan to start medical school. So if you take the MCAT in 2025, the scores are going to be good for 3 application cycles. And if you want more information about the MCAT, you will need to, let me move this. You can go over here to the QR code that I have here. A lot of the information I'm going to share with you is actually on our public website. So I'll try to, I included a QR code for a lot of these pages. We talked a little bit about the prerequisites and how you can work with the pre-med advisors in making sure that you get these met. I strongly encourage you to have all of these prerequisites done before you submit your application. But our requirement is that you can finish these up before you start medical school. Having them done before you submit your application means that the admissions committee can actually see the grades for those classes that you took. We also will take classes. If you got college credit for AP classes, we will accept that towards the prerequisites. If you took classes at a community college, we will accept them toward the prerequisites as well. That policy is going to vary with every single medical school that you apply to. So we're part of the American Medical College Application Service, which is a centralized application system. Our deadline for this upcoming cycle is October 1st. And here you can see I've included the application fee for 2025. So it's $175 for one medical school application and $46 for each subsequent school that you apply to. The average student applies to about 12 to 15 medical schools. So that can be pricey, and nobody wants finances to be the reason why someone decides not to apply to medical school. So the WWAMI has a fee assistance program available for students. If you qualify, you can get a reduction of your MCAT registration fees. You will get MCAT prep resources. This is something that I recommend that all students look into, which is the medical school admissions requirements. This is a database that basically collects all the information from all of the allopathic ND schools about their mission statements, prerequisites, deadlines, as well as demographic statistics and information about the curriculum and student life. So this is a great way to kind of decide what schools you want to apply to and be able to narrow and compare them across a graded table. Everyone is asked to complete the same questions and prompts, so you're able to kind of compare apples to apples in that way. Another benefit is that you get to waive all your MCAS fees, and you can apply to up to 20 medical schools if you qualify for this program. And then there's also a waiver of the WWAMI preview, which is a situational judgment test that some medical schools will require you to complete as part of the process. The University of Washington does not require you to take preview, nor do we require people to take the other popular situational judgment test, CASPER. But some schools might. So again, just double check and see what the requirements are for all the schools that you are applying to. So as part of the AMCAS application, they're gonna ask questions that all schools are gonna wanna know. We're gonna wanna know, what have you done leading up to where you are today? And so what we're gonna wanna know is, what clinical experiences and exposure have you had? One thing I really do wanna emphasize is that we don't have a requirement for shadowing. There's no minimum hours. There are many different ways to get clinical experiences, and I do recommend you check our website out for just more information about our philosophy about clinical exposures. We expect all of our folks to have had some community service. Does not necessarily have to be clinically related, but that could be beneficial. Because being a physician is a service profession, we want to see that you've had experience putting other people's needs before your own. We want to see that you've engaged with patients. Have you talked to people who you could be serving as doctors and caring for? What leadership have you demonstrated in your life? So this could be what you would expect to be fancy title for a certain organization. It could be just being a leader within your own family because your parents are both usually out of the house in the morning and you're the one responsible for getting your younger siblings fed, clothed, and out the door. Research is something that a lot of students have, but it's not a requirement for the University of Washington. It does become a requirement if you apply to our MD PhD program, or you tell us you want to do research. Employment is something that I strongly encourage folks to include in their application because you learn a lot of different skills that are very transferable to the profession of medicine. So for example, you could be a server at a fast-paced restaurant, you're working on a team, you're working with very demanding people, and sometimes you have to deliver bad news, like you're at a burger joint and you ran out of French fries. Everyone's upset because the fryer is broken. So those are things that I think is helpful for you to kind of include in your application. One, because people know where you're spending your time. Someone who's working full-time, trying to put themselves through college, they are going to recognize are going to have less time to volunteer or, you know, get clinical experience than someone who does not have that responsibility. And then also hobbies, interests, or any activities that are meaningful to you because you're not just a pre-med student, you are more than that. And so we want to see what you do that brings you joy. What are the things that are really exciting to you? What are things that you do when you're stressed that you can turn to as a way to be able to kind of rejuvenate yourself? And also the reality is that a lot of our medical students are kind of interesting. I mean, we have folks who were professional dancers and they still dance, or people who coach, you know, like high school sports teams. We have folks who run food blogs or free med blogs. Anyway, the point is that we want to be able to see that you are a whole person and you have many different interests, not just getting into medical school. Sorry, kind of that weird stage. A common question I get from applicants is, what can I do to stand out? The reality is that a lot of pre-med students, a lot of applicants are going to have very, very similar experiences. Because again, we all expect you to have shadowing, we all expect you to have clinical experiences, we all expect you to have had some leadership experiences. What really sets people apart is not necessarily what specific activity they do, but what do they say about that experience? So when you're filling out that experiences section in your AMCAS application, I recommend that you treat each entry like it is a little mini essay. So anybody who's familiar with resume writing? Like, raise your hands. Okay, so resume writing, it's about bullets, it's about being brief, it's about describing what you did, right? Yeah, don't do that for your medical school application. We actually want the opposite of that. We want to know, what did you gain from that experience? What you do may or may not be as important depending on what activity you're writing about. If you're volunteering for Habitat for Humanity, we recognize you're probably building houses. We don't need to learn about, like what tools you used or what part of the house you built. We want to know, what did you take away from that experience that really helped you understand what that organization was doing? What did it mean to the people who were receiving this house? Who were the people that you talked to? What was the significance of that to that community? What the impact could have been? What did you learn about yourself from that activity? We really want to be able to see everything in your application, see these activities through your lens. So when you're thinking about when you're writing these experiences, these are some kind of prompts to kind of help you. When you're writing about that, like, have you really pushed yourself beyond your comfort zone? What are some of the insights that you gained? Are you someone who really learns from your experiences and activities? How do you interact with people? Do you come across as mature? What did you learn? We want to know from reading your whole application, what are your thoughts on communication? What are your thoughts about teamwork? What are your thoughts about being a leader? What are your thoughts about medicine and the healthcare system? What are your thoughts about patient care? We want to be able to really see the world through your eyes in the materials that you submit to us. So, MCAS application will have a prompt. It will ask you to talk about why you want to go to medical school. I want to challenge you to really think beyond that and talk about why you want to be a doctor. Because again, this is what the whole process is about. So, motivation for medicine, description of prior experiences in healthcare, steps to explore a career in medicine, and also what your eventual goals could be. Remember, we figured you're going to change your mind about what specialty you want to do from when you apply to when you graduate. But we do want you to be thinking beyond just getting into the program and thinking about what kind of doctor could you be? Are you someone who wants to go back and serve a specific community? Do you have experiences that support that? Are you someone who wants to be a physician that always partners with their patient in their care? Then what are the specialties that could potentially allow you to do that? And so that's really what we're thinking about as goals as a physician, not necessarily specialty related, but more broader than that. Secondary application is what schools will send to applicants after we get the ABCAS application. Because the ABCAS application is the same information going to everyone, the secondary is an opportunity for us to learn a little bit more about things that are specific to our program. So this is when we'll ask you to write additional statements. This is when you'll send us letters of recommendations, and also when you'll go through the process of verifying that you're eligible for the Alaska WWAMI program. Now, letters of recommendations are fairly open-ended for us. We require either a committee letter, if your school provides it, or 3 letters of recommendations from anybody who you want to write on your behalf. And then we will accept an additional 3 letters on top of that. We don't have a requirement for you must have letters from this kind of person or that kind of person. We want you to really look at your application and decide who can speak to your strengths the best. And so ultimately, we really, again, want a well-rounded kind of view of you. And so just choose folks who speak to your academic ability, people who can speak to how you interact with other people who can speak to what you would be as a physician, how you are as a team. Really, again, just kind of open-ended who you want to have right on your behalf. One thing I will add is that you would be surprised at how much impact you really have on your letters of recommendations. What you'll learn is that writers love to have direction. So when you are getting your letter of recommendation, I always recommend that you ask someone first, right off the bat, can you write me a strong letter of recommendation? If they hesitate, probably not going to be a strong letter of recommendation. Go ahead and ask someone else. But if they give you an enthusiastic yes, then really spend some time to give them resources and directions. So that means giving them a copy of your application if you have it, or your CV, letting them telling them that, hey, I know that you've seen me really take the lead on a lot of group projects. I want you to really talk about that in the letter. That is something that is really helpful for writers. And also very important, make sure you give them a soft deadline. So that means don't give them the deadline of when you kind of send in the application, but give them a deadline that's like a month, 2 months beforehand. And then maybe make sure to give them plenty of time to write it. So typically give folks 6 weeks to write a letter for you. And then if they if you don't see anything in 6 weeks, then follow up. I can give them a deadline extension at that point. All right, so let's talk about the application process. So you take the MCAT, you submit your AMCAS application. That is when there is a preliminary screening and academic screening. So something to keep in mind is that applicants with low GPA and low MCAT score could be rejected before they get invited to complete a secondary application. And the reason is because it is an automated way to help us manage the volume of applications that we get. Some states do choose to do a what we call a below screen. So folks who are below our GPA and MCAT cutoff could then go to the XCOM member from their state, who will then review the application and decide if they want to move them forward in the application process. So last year, Alaska participated in the below screen process. So anybody who was below our cutoff, which was 2.7 GPA and also 498 on the MCAT. Then in that case, they went to the Alaska XCOM member to review the application. We do require U.S. permanent residency and citizenship to be considered. And we do limit the number of times that people can apply because we really want folks who are not successful to take some time off to really get some new experiences, to rewrite their application and then try again. As you can see earlier, the deadline of when you will hear back and when the application will open up again is very short. So there's only so much you can do in a couple of months before, if you want to send your application in early. The other thing I want to also mention is that if you do find yourself that you have to reapply, our school will provide written feedback to WWAMI applicants that are not accepted anywhere, so that you can use that information to help prepare a stronger application next time around. Here you can see just like a snapshot of, go ahead and hide this, the GPA and MCAT for Alaska students only, because you folks who applied, offers that were made, and then also those that are entering. People who are above that academic cutoff or from WWAMI will automatically get a secondary application. And then for folks who are outside of WWAMI, if they're applying to us, they will get a secondary. If they're above the academic cutoff, the cutoff is actually higher for non-WWAMI applicants. And then also if they demonstrate a commitment to working with underserved, come from a disadvantaged background, and also has a tie to WWAMI. So you get the secondary application, you submit that, and then this is where we decide if you will be invited to interview. So all completed applications are going to be sent to 2 to 3 screeners total. If what we'll do is we'll send your file to 2 screeners. Independently on their own, they will look over the application, decide if an interview should be extended. If the outcome is a negative screen, then it goes to a 3rd screener, who is, again, that Alaska XCOM member, who will review your application and decide if they want to invite you to interview. The reason we do that is because we recognize that vast majority of our screeners are not from Alaska. We're not going to be familiar with which towns are going to be the rural towns, which towns are the big cities. And so as a result, we really value having our Alaska XCOM member involved in the screening process because they are aware of what opportunities are available in where you're from. So they will do a review if you have a negative screen and then make a final decision. And then because everyone's spending so much time to review your application, it can take up to 6 weeks. Now, the things that we're thinking about when we are looking at your application is, do you just have the basics? Oh, sorry. When we're looking at your grades, when we're looking at your MCATs, we're seeing, is there an upward trend? We're looking for, do you have any clinical experiences? Have you done any service? Is what you're doing consistent with what you're telling us you want to do in your statements? Common thing that happens is that we get a lot of people telling us they want to go into rural primary care because we are known nationally for that. And then when we look at their application, it's like, oh, you've only shadowed radiologists and you've only been living in big cities. How can you know that that's what you want to do? So we're really looking to see if you've done what you need to do to really explore the profession that you tell us you want to do. We're looking for clear and coherent motivation for medicine. The reality is that we recognize when folks say that they love science and they want to help people, that it's probably true, but it can apply to many, many different professions. And so we really want folks to be able to tell us why do they want to be a doctor specifically. This is when we'll be looking for solid letters of recommendations and also just does your mission align with our mission? After you are invited to interview, you can be interviewed during that time frame. Here are the things that we get from your AMCAS application, your written application, but this is where, but in the interview is an opportunity for us to really kind of reaffirm what we have read, but also get a sense of just how do you communicate with other people? How do you problem solve on your feet? You might get ethical scenarios and be asked to talk it through. And then just, what do you understand what you're getting yourself into? We do panel interviews, which is a little bit different from what other schools do. Every school has their own format that they prefer. Some schools will do traditional one-on-one interviews. Some schools will do multiple mini interviews, which they always hate when I say it this way, but it's like speed dating. We choose panel interviews because we like that it's an opportunity for applicants to meet with 3 interviewers at once. And also all 3 interviewers are hearing the same questions that are being asked, as well as hearing the same responses. And so they're able to evaluate on their own independently. They're not allowed to talk about how your interview went until after they submit their own individual impression of the interview. And it's only after that impression is submitted that they discuss and then they make a recommendation on your file. Alaska residents will have at least 1 Alaska interviewer, most likely 2 Alaska interviewers on your interview panel. Also, we are doing virtual interviews because we recognize how expensive it is to fly around the country and take time off of work. And so we do video interviews as a way to, again, just kind of lower the barriers and access to this profession. Once you've done your interview, expect 30 minutes. Interview impressions are written. They've had their discussion, they write a summary of their discussion. All of that gets forwarded to the executive committee, which again is the folks who have who will be making all the final decisions. So here I have just like number of applications of folks who applied, secondaries completed, interviews, and then offers at entering class. You can go to our website to actually get more statistics about like the demographic breakdowns, as well as information about alternate lists. I only have the data for 2024 because we're still in the middle of the current 2025 application, so there's really not much numbers I can really show you at this point. Folks who are in high school, folks who are freshmen, in college, I want to bring to your attention the Summer Health Professionals Education Program. This is an excellent enrichment program that's offered during the summer where students can learn more about medicine, or public health, and being able to network with other physicians who are other physicians who are interested in serving underserved communities, as well as be able to meet other folks who are similarly interested in becoming doctors as well. Students get $1,000 stipend plus food budget, and I am going to move this QR code so that you can bookmark it, but I definitely recommend that you check this out if you haven't. If you're not, if you can still take this opportunity. The current application has already closed, but again, if you're planning your future out, this is something to keep in mind. So what I have shared with you is a lot of information, I recognize. We have a lot more information on our website, including videos from Dr. Buski, our admissions dean, going into our application process, how to prepare for our interviews. And then I also have our social media stuff because I am trying to drum up likes, but also because this is the best way for us to really reach out to folks who are not already applying to our program. And also feel free to reach out to us. I've included our phone number as well as our prospective email if you have any questions. Okay. With that, happy to take any questions y'all have in the room. Yes.
Thanks that was awesome. Wondering if you could touch on some of the wheelhouse for us non-traditional people, a little bit older than the general cohort, and how graduate GPAs are tied in, if they're reviewed completely separately, if they're averaged or someplace look at the last 30 credit hours, how do you do that?
All right, I know that folks are on Zoom, so I'm gonna repeat your question, so they can hear that and then also answer it. The question is, how are graduate GPA viewed? And how is it used in the application process? So, for our academic screening, it is automated, so it is not considered for that. However, one thing I want to really strongly encourage everyone in this room is to be an advocate for your application. So, if you end up falling below that academic cutoff because you were still finding your direction in undergrad, and you might have been screened out, you can always reach out to our office and ask for a manual screen. So when that happens, I personally will look at your application, see if there's an upward trajectory, see if you have a solid MTEST score, and then I can put you back into the application pool. Once you get to that part where you're filling out a secondary application, anytime someone looks at your application, they get the whole file. So that means when the screeners are deciding if you're going to be invited to interview, they are going to be able to see your graduate grades. They're going to be able to see your graduate GPA. That also means when you're interviewing, the interviewer that has access to your grades will be able to see that as well. And then they can always discuss that at the executive committee. I just realized I left a very important thing out earlier when I was talking about the interview, is about who has access to what when you are meeting with them for the interview. Two of the interviewers will not have access to your grades or your MCAT scores because we want them to be unbiased by those statistics. Only the executive committee member will have the open file. So during your interview, they're not allowed to share that piece of information. The other two interviewers would have seen everything else. They would have seen your activities, they would have seen your statements. Only after those forms are submitted, then they can share that grades and MCATs, and then again make a decision. Yes.
For the automated GPA screening, is that an aggregate score based on all schools attended, or is that like if you graduated your undergrad with a certain GPA, is that the GPA considered, or is it an aggregate score from all schools ever attended that you're submitting on your application?
So the question is, what GPA does the academic screen use? And the GPA that's used is your undergrad GPA the first 4 years, as it is put in the MCAT application. So that's what we use for the academic screen.
The first 4 years you're ever in. If you're a non-traditional student, you've been out of school for a while, then you go back and finish.
Yes, which is why we really do encourage folks who are not invited to complete a secondary application, even though they are from WWAMI. And they know that they could have been affected by the academic stream, to email our office directly, and we'll do a manual review.
Yep.
Yeah. Yes.
Who, say that 1 or 2 Alaskans are on the interview committee? Are those doctors here in Alaska? Are those just people who volunteer to be on your committee, or what's that?
So all of so the question is about who are the Alaska interviewers? Our Alaska interviewers are current physicians. Some of them are alums of the program, some of them are faculty. All of our admissions committee members are doing this out of the goodness of their heart, and it's a service that they're doing. And without them, we would not be able to do any of the admissions process. So I always try to give them a shout out, demonstrate my appreciation for them. But yeah, so they basically take a week out of their life and they devote it to meeting all of the applicants for that season, having very late night meetings, talking about the files, and then participate in the discussion on who to admit. Our larger admissions committee is going to include current medical students, alums from other states outside of our region, other faculty member researchers, other healthcare professionals. We have had PAs, nurses, biomedical researchers are all involved. We've had folks who are also medical school adjacent, so they're administrators, but they work for this medical school, and has a very wide background and of folks who are able to look at your application. I think that's the other reason why we really like panel interviews, is because we realize that folks bring in and hear the experience interview from their own lens, from their own experiences. And so having 3 people, again, just kind of hearing the same answers, hearing the same questions, being able to kind of look at it from their different perspectives that they have, you know, like someone who's a current medical student can pop up to be in the interview thinking about the applicant as someone who could be their colleague, who could be a classmate, someone who is a nurse who's in the interview thinking about, is this a position I would be able to work with in a, you know, as part of my team, so on. So it's kind of helpful for us in that respect.
Can I say something about the Alaska Admissions Committee specifically? Yes. We cast a wide net for Alaska physicians, and what we are looking for is a balance between specialty care and primary care. And we're looking for a balance between urban and rural providers. So we specifically look to make sure that we have a balance of more rural providers. We have a balance across all of the specialties. We usually get lots of physicians who are interested in where the workforce is going forward.
Yes.
So one question is, which real world experiences or volunteer experiences stand out on the application? Why? Is there a specific trend that you guys look for? Or do you just look for something unique or hours? What do you look for?
So the question is, what experiences we look for? Honestly, what stands out for us is really just what you say about that activity and experience. So, I think we want people who are very thoughtful, people who are really reflective, people who are really paying attention to others as well in their activities and experiences, someone who's able to kind of look at like the activity that I'm doing might be the same activity that 50 other people are doing, but if they're able to kind of bring in this perspective that others have not really seen, that is what's going to really make that person stand out. Number of hours is not as critical because some people learn a lot in 20 hours versus someone who did 100 hours, but they were on their cell phone the entire time. With that said, I will say that you do get to see more the more you do a specific activity. So I mean, like, there is that balance of like, the longer you do something, the more you can talk about it. There's only so much you can talk about something that you've done very limited time with. Yes. Yeah.
Well, I just want to say thank you, Christine, for your presentation. My question is for letter of recommendation, is there, can it be like, is there like an expiration date, just to put it like, as a for taking class, you know, with good experience with a professor, do we use letter of recommendations that are just like a couple of years for the application date?
So the question is there an expiration date for letters of recommendations?
Yes.
And yes and no. So in the scenario that you presented where you have a really good relationship with a first year professor, you want them to write a letter for you, but you're not planning to apply until 3 or 4 years down the line. I would recommend that you get that letter of recommendation as soon as you're about to separate. Because that is when they're gonna remember you the best. And so have them write that letter, have them put it in an envelope, have them do something to make it tamper-proof. You can also pay and do Interfolio, which is an online subscription that they can send their letter to. Hold on to that letter and also make sure that you stay in contact with that professor over the years. And then when you're ready to apply, then you reach back out to that professor and say, hey, I'm about to apply to medical school. Remember how we talked about that? Here's a letter that you wrote to me 3 years ago. Can you update the dates? And maybe add anything new or relevant that I've been doing recently? And then you can use that letter for the application.
I have a follow-up question. For the letter of recommendation, you mentioned a committee letter or the 3 letters of recommendation. Who's the committee in that committee letter?
So the question is about committee letters. Not all universities offer committee letter. Actually.
Yes, we do.
I know, you guys do. I was hoping like Dr. Beck might be here to talk more about that process, but it looks like she is not.
She's just walked in. Every time. Committee letters.
What is the question? Oh, we can talk about committee letters.
Committee letter, yes. So for us, how we do committee letters here is if you are interested in a committee letter, you can go to the website and you can fill out a very 2-minute application for that. And it's basically telling us that you want that. Dr. Van Tetz and I will then, at the end of April, we will look at all those and we will kind of divvy out who's going to write what letters. In the meantime, you are collecting all of your letters of recommendation and you are going to have them sent to us. And this is all explained on the email. You're going to have it sent to our pre-med advising group. And Elida is going to organize them all for us. And then we will write a letter summarizing what we know about you and what our experiences are with you and what you bring. And we will meet with you beforehand and give you a bit of an interview. I tend to treat mine like a practice interview, so you get a little bit of practice. And then we write something about you and we write our letter about our experiences with you and what you bring to the table. And then we attach all of your letters of recommendation and submit them as one package. Did I give you more information than you wanted to?
That was great. I just want to clarify what website can we go for this?
So our pre-med advising website. So if you go in there, there is a preparing to apply part of the website, and under there, there's a section for committee letters.
So if you Google Alaska WWAMI pre-med advising, it should pop up.
And if you haven't started talking with your pre-med advisor yet, Dr. Van Tetz or myself or both of us, then you should be doing that, right? So that way we get to know you better. The better we know you, the better letters we can write for you.
Thank you.
Hey, I'm gonna suggest we say thank you very much to Stella Okay, so just so that we know where we're going next, at 10:45, so you have about 5 minutes. We're going to start another session with Dr. Holly Martinson here on research within UAA, College of Health. In room 117. So if you go out those doors, turn to the right, go past the big orange sign, you'll find it. The Doctor of Pharmacy and the PA program are doing a presentation with more information, and then Dr. Uppenbeck will be doing a workshop on applying, and that's in 110. So out those doors and straight across beside where you registered. Okay, thank you.
It was great. Just letting those of you know who are online that the in-person group is now having a 5-minute break, and the next presentation will be at 10:45, and that'll be Linda Hernandez and Janelle Richards on turning healthcare dreams into reality. I know Linda in particularly quite well. She's been involved in pathways work for a long time for the College of Health and for the medical school. And so I'm not entirely sure what they're covering in their half-hour presentation, but I would assume it's on how, as an undergraduate or a high school student, you can walk through those steps to succeed and get through to college. Obviously, there'll be an opportunity for questions then. So I just sort of hop in and let you know that that's what's going on. And in now 4 minutes, that should restart.
Okay, sorry, technical difficulties here in the room. Okay, thanks for joining, everybody. My name's Holly Martinson. I'm an associate professor here at University of Alaska Anchorage. I've been teaching for the WWAMI program for 10 years. I was born and raised in Alaska, and I graduated from the University of Alaska Anchorage with my chemistry degree. So a little bit about myself. I will get into a little bit about my research, but I wanted to, while I was driving over here, is actually thinking of some of my students that have participated in research and sort of what they've accomplished. And one of my favorite memories was actually the first time I gave a presentation like this at the PreMed Summit. And this was 8 years ago. A student sat in front, same room, and listened to my presentation about the importance of research and how it can really build your critical thinking skills and everything that you need to have in order to be a good scientist, a good medical doctor, or just a good person in general. And she came up to me afterwards and she said, "I want to work in your lab." And I said, "That's awesome. I'm super excited because I love when students, you know, are really engaged." And she's like, "No, but I want to work in your lab." And I was like, "Okay, so tell me a little bit about yourself." She's like, "I'm a freshman." I was like, "Oh, that's awesome. It's a perfect time to start." She's like, "I'm a freshman in high school." And I was like, "Oh, okay." Well, I was like, "You got a few years." She's like, "No, but I want to start now." And I said, "Okay." It's really difficult to get minors in a lab, a research lab, where you're working with like liquid nitrogen, lots of different chemicals, tissues. She came every week to my lab and said, "I want to work, I want to work." So I set her up. I went through all the procedures to get her in. She came in every week for 4 years. Worked on a different project. She worked with a bunch of different students, many of my students that have gone to medical school, and did awesome. She ended up publishing a paper. She did before she even graduated from high school. She first author paper, and she told me that freshman year, actually, when she came in, I said, "Well, what do you want to do? What do you want to accomplish?" And she said, "I want to go to a BSMD program." I was like, "What?" I'm a first generation college student. I didn't even know what a PhD, MD, and what those titles meant. So BSMD, I didn't even know that they existed. So she told me that her freshman year, got in her senior year to a BSMD program at Rochester Institute of Technology. I was like, wow, she's ready to go. Last year she contacted me and said, "I don't want to do a BSMD. I want to do an MD PhD." And I said, "What?" She's like, "I've done research. I did research for 4 years with you. I've done research the past 4 years at Merck, BD, all these different pharmaceutical companies. I've done research at Rochester Institute of Technology. I want an MD PhD." And I said, "Okay, well, you know, I'll support you 100%. She's like, "I want you to write a letter." And I was like, I worked with you in high school." She's like, "No, but your research was extremely important to me. You gave me the foundation. I want you to provide a letter for my package." And I was like, "Okay, this is your package. You get to put it in." She's called me last fall because they do interviews really early. She got into the MD PhD program. This is extremely competitive programs. So she will be attending the MD PhD program at SUNY this year. But that was 8 years reflection back to a student coming up and asking me about how do they get involved in research and being persistent to get involved in research. I was the first person she called. She's had 8 years, and I was the first person she called, and I still, like, it means so much to me, and I'm super excited for what she's accomplished. And so I hope that this talk will get you excited about research and the potential to be involved in research and how it can really help you get to where you want to be, whether it's grad school, medical school, wherever you want to go in life. Hopefully research will help you get there. So a little bit about myself. I can get these slides going.
I started, obviously, I grew up in Alaska. My first project was in the chemistry department. I proposed and wrote my own research project, got my own research funding from the Alaska EMRI program that's funded by the National Institutes of Health. We still continue to fund that program, and I'm one of the directors of the student research program for that. I studied different persistent organic pollutants in bivalves. So I was really interested in bivalves as potential filter feeders of the water. We looked at Cook Inlet and then also Cove, Sadie Cove, and outside of Homer. And we looked at the presence of persistent organic pollutants in bivalves. I then went on to graduate school at the University of Colorado, and I studied young women's breast cancer. We see a higher incidence of breast cancer in women following pregnancy, particularly in older women who never actually, pregnancy never becomes protective. So women never get pregnant, or if they never become pregnant, then they have this line of one. You can see that women that do get pregnant have this increase in risk of breast cancer in the beginning, and then it'll go down and what we would traditionally know that pregnancy is protective against breast cancer. But if you're over the age of 30, you actually never get that protective effect of breast cancer. And I studied the immune system and how that's tumor promotional during that particular time following pregnancy, and how we could potentially target that with different chemotherapeutics. Sorry, we can you please mute? Thank you. So then I came back to Alaska after I graduated with a cancer biology degree and studied cancer health disparities in the Alaska Native population. One of the cancers that we were really interested in is gastric cancer, and we saw this huge increase in the prevalence of gastric cancer in the population. We started to molecularly characterize it as well as genetically characterize it. And then the work that I continue on now is working with nanoparticles to use as immune modulators. So you can potentially use this as a cancer vaccine or as a way to deliver agent to the immune system to reprogram it so that instead of being tumor promotional, it now helps attack the cancer. And so we use liposomes, these nanoparticles, and then you can put different things within the liposomes or attach it to the outside. They bind to complement within the blood, are taken out by antigen presenting cells, and then activate T cells so that we can potentially help train our immune system to attack our cancers. So that was a little bit of background of me and how I've been involved in research and continue to be involved in research. And I have a couple students that are within this group, not necessarily in this room, but that are actively working on our research in our lab here today. So why, how, and when should you get involved in research? So everything that you probably are wanting to be here for, hopefully I can answer in the next few slides. I also, if you guys have any questions throughout the talk, feel free to interrupt me and just raise your hand and ask a question because I like interaction. Okay, so, oh, you guys can see this. I used to be better at this, but we don't use Zoom all the time anymore. We actually teach in the classroom. There we go. Okay, now you can see it. Okay, so why is research important? So why do you guys, why can't you just take the classes and apply to them, right? Why does research give you an edge? So the things that we do in the lab helps build and strengthen critical thinking skills, the same skills that you would when you go into a room with a patient and you listen to them and talk to them about the problems that they have. You're going to use those same critical thinking skills in research or with your patients to solve their issues, solve their problems, help figure out what the next steps are. Those are analytical and critical thinking skills that you'll build in a lab doing research. Increase user confidence. This is the number one thing I see in my students. Why? Because they work directly with a mentor. So you can ask questions, you can get a little bit more comfortable. You don't necessarily have to work in front of a whole classroom. You work one-on-one with somebody, so it helps build your confidence. Maybe you're not sure about something at first, but you do it repetitively over and over and you realize, yeah, I am capable of doing this. Research help builds that.
Boost resume and career preparation, probably the number one reason why a lot of students contact me. How do I get to be that application that somebody's gonna look at? They're not necessarily gonna look at just whether you can get really high test scores. It's not the most important. And they're not looking at whether you have the best grades. They're looking at the big picture. What's the big package that you're bringing forth to them? So it helps because it adds to that package. You can also discuss your research. If you get into any of this, all of my students say that if they put research on there, they discuss it and they're ready for that because they've practiced that scientific communication. So being able to communicate about your research is really important as well. So developing relationships with faculty, mentors, and peers. So my research lab has high school students, it has middle college students, it has undergraduate students, it has post-bac students that are in between their BS and whatever it is, that program they want to go into. We have master's level students, I have PhD students, and sometimes we have postdocs. Huge range of people that students can interact with, get guidance from, one-on-one guidance, ask them. So I have students that are applying to medical school. And now I have students that just got into medical school. So those students can now mentor those other students about, hey, this is how my interview went. You know, there's all these different opportunities that you get within a research lab. It's a small community, but with big benefits. Being part of an on-campus scholarly network, you have the opportunity to talk about what cool things you're doing. This isn't something that you have to do. No one has to do research in college. So it's that extra bonus. A place where you can talk about what you're doing, network. So that is another big thing that students get out of research is networking with people within their community. Potentially you're going to conferences where you can actually talk about your scientific research and network with people. I've had students get into programs outside of Alaska at OHSU because they had networking opportunities to talk with them about the different programs and opportunities that are available. Lots of really cool opportunities when you go and talk about your research and present your research at these conferences. Opportunity to publish, like I mentioned, that student, she had the opportunity to publish her research. That's the goal of every time I get a student in the lab. How can we get them on a paper? How can we get them to do something significant in the lab that can contribute to our next publication so that they actually walk away with something that they can now put on their resume? You can still put on the experience on your resume, even if you don't get a publication. So that's not always an option for some students, depending on how much time you have to build research in the lab. You need a year or two. On track to graduation, we have data from nationally as well as at UAA. Students that do participate in research graduate more likely on time, are more likely to graduate, have better grades. It builds regardless of any of the ethnic, sex, all the different factors that you look at. Research is one of those factors that helps get you to where you need to be. It also increases the probability of getting accepted into graduate and medical school. This is huge. I had 2 students that just got accepted into medical school that are in my program. The other program that I run, a student just got accepted into the pathobiology program at UW to study tuberculosis. Any questions on that? Hopefully that helped. So how do you get involved? This is probably, everybody's like, yeah, cool, research is awesome. This is probably the hardest thing for students, right? Because you can get excited about research, you can start to read scientific literature, anybody can go on to PubMed or Google Scholar, look up articles about their favorite topic. But how do you actually get in a lab? So there's a lot of different opportunities here at UAA. I'm not 100% sure if you decide to go to another university, what opportunities are there. But at UAA, we have a bunch of different programs. So some of the programs include some of the university's Office of Undergraduate Research is a good place to start. McNair Scholars, so we have that here at UAA, as well as other universities. I have a list of other programs that are available. So these are ways that you can start to figure out what research is being done. You can also ask your instructors, many of them are potentially involved in research, or you can ask them how you can get involved in research. A lot of people want to help you, so don't be afraid to ask. Contact your faculty about working on research. If there's any talks that are given at the university, attend one and see who's there. Potentially talk with somebody about how they got involved in research. Ask your peers, anybody that you know that's working on research, how did they get involved? So look for those opportunities. There are also research grants, fellowships, and scholarships that students can apply for in order to do undergraduate research. You're gonna have to look to see what's available at your university. Hopefully there's an undergraduate research site. There's an office of undergraduate research here at UAA, so you can look for opportunities there. Sometimes it's just by word of mouth, posters that are on the buildings or within the buildings you can look for. There's also opportunities to present at local conferences. So there's travel funding, Office of Undergraduate Research, as well as through the Alaska Embry program. So if you do get involved in research, it's often, I always suggest for students to go to a national conference so they have the opportunity to present their research, to network, and kind of see what else is out there. It's also something you can put on your resume. Okay, so when to start? Obviously, my example of the student, I would have said sometimes it's too early, but for her, it was perfect. So you can start your freshman year if you can find somebody to work with in high school. So that could be through classes, it could be through participating in events at the on campus here. It could be just attending workshops or a seminar. Research can take hold everywhere, right? It could be a talk that you go to. It could be something that you're learning in your science class. You could do a science fair experiment. That's all part of getting started in research. That really helps build the skills and the techniques that you're going to need in order to do a deeper involvement later on. So deeper involvement, I would suggest if you really want to get into research, your junior and senior year of college are probably the best times to potentially get into different programs as well as develop skills, because you've sort of already got your base academic foundation through your general education requirements, right? So now you can start to take those science classes and build those skills that you'll need in order to do and conduct the research. There's also lots of other programs. There's research internships. So many of my students that are working with research here at UAA will do summer internships in Oregon Health Sciences. So I have students that are going down there to do fellowships or summer research programs, which are called REUs. And those are funded by the National Science Foundation. And those are available to any student as well. If you maybe didn't have time to get involved when you had your undergraduate years, doing a post-bac, working with somebody during a post-bac. So I know that here at UAA, we have a post-bac program to help students get the college courses that they need. And those students can participate in the post-bac program there, or even accelerated masters. If you students are maybe want to add an additional year, they can do an accelerated masters here at UAA and work on research skills that they maybe didn't get in undergrad. And then finally, if you're applying and you still haven't done any research, WWAMI has developed a clinical translational research pathway, which I'm co-director of. And so you can do research here. So I have 12 students this year and my cohort from Alaska. And so I have students that have never done research before. So that's the whole point of them being in that pathway, is to build those skills and develop that knowledge that maybe they didn't have. And I also have students that have done research for years in that kind of, so it's a great community where you learn off of each other, because we are all talking about the projects that they're going to be working on this summer and build on that research knowledge. So it's never too late to start, and it's never too early to start, I guess, either. Research opportunities at UAA, we have different programs. We have AKU Rise, which is funded by the Alaska Space Grants. That's really helped support students in their freshman and sophomore year, kind of get engaged in research and start to take some classes. I also mentioned the Alaska Embry program, which is who funded me when I was in school here. and they continue to support undergraduate research. We have lots of different opportunities and help provide opportunities for students and also to connect them to mentors that potentially that they're wanting to work with. So that's all funded by the National Institutes of Health. I also have a training grant called the Biomed URISE program. So that's a 2-year program for juniors and seniors. So that's really to help students get more out of research. So maybe not just taking a semester, but actually doing 2 full years. That they'll do their first year here at UAA. They'll spend a summer with our collaborators at OHSU for the summer between their junior and senior year, and then a year back at UAA. It funds a stipend, it funds their tuition. The program is 100% basically for the students. It's great, really supportive. So students don't feel like they have to work. It really allows them to fully participate in research. There's also the McNair program that I mentioned, TRIO program, also awesome. And then the clinical translational research pathway, another one, once you get into medical school. Okay, that's all I have. Do you guys have questions? Yeah.
If you're not a UAA student, how would you like best like try to participate in a local research program, like either through a UAA or through Providence? Like for non-UAA students, what's like the first resource for looking for these sorts of research programs?
Yeah, that's a good question. So I've had students contact me directly. So there's opportunities. So one of our students that's working in the lab, she's it's not necessarily a postdoc. She already has her bachelor's degree and is just working and volunteering, and we pay her now for the research that she's doing, and then she's going to medical school. So this summer, so there's opportunities there. If there's space available, we have very limited opportunities for research because of a lot of different things that we probably shouldn't talk about. So there's just, you sort of have to fight for those opportunities and contact people. I can be a resource and try to help direct. We really do have a lot of the professors here at UAA would really like those opportunities to be for UAA students. So, but there's always maybe ways that we could potentially find a program. Yeah. Yeah.
So how often might other research be that's not necessarily biomedical, let's say the other side or other forms of health?
Any type of research is important. So what you want to get out of it and what you present, it's better to dive deeper into a project that you're really interested in versus something that you think that medical school might want to hear about. Because you're going to be able to really advocate for what you've done and what you've accomplished and why you were excited about it. And that's what they want to hear. Regardless of what you do, whether, like I studied plants, so there's nothing to do with, and I still got into a biomedical science program. That was full on analytical chemistry. No human component. I mean, obviously we're eating the plants. But that's, like what you dive into. I always tell my students, it's better to dive deeper than to scratch the surface and try to do 100 different projects, because that's just gonna make it seem like you're not really sure of what you want to do versus you really get a true experience of diving deeper into that project. So I always tell students to try to dive as deep as you can, because there's so many more opportunities. There's leadership, you could be mentoring students. So that's kind of why I like programs that have 2-year components, because by that second year, my students are mentoring other students. You're building those skills now. You're building those leadership skills. All these different skills that you're building are what you can talk about in your personal statement. That's what you want to talk about in your personal statement, right? It's all those different skills that you're building, you're going to be able to use later on in medical school. I think we're supposed to end, but if anybody else has any questions, let me know. Yeah.
Off the top of your head, do you know any of the research opportunities maybe offered through UAF? For people?
Yeah, there's definitely opportunities at UAF. Again, you'll have to contact the faculty up there. The Alaska Embry program also works with faculty that are more biomedical oriented, because that's the National Institutes of Health funding. So potentially contacting through them, and then maybe they can link you up with a faculty member. So yeah, there's definitely opportunities up there as well. Anything else?
Holly, can you hear me?
Yeah,
Yep. I have a question from one of the online attendees asking,
Okay.
can research in non-medical fields help with med school admissions?
yes, for sure. Like I was saying, you don't, just because you're applying to medical school doesn't necessarily mean the research that you're doing needs to be biomedical based. Like I said, I did chemistry and applied to a biomedical science program. You don't, my medical students ask me the same thing. I want to do orthopedics, so I need to do orthopedic research, and I'm like, okay, have fun trying to find that. There's other opportunities, and if you're really interested in studying something, this is an opportunity for you to study that and then build those skills and apply it when you get into the orthopedic residency program and you're now doing research for them, right? So what you do now doesn't necessarily have to be exactly what you're going to do in the future. This is a time to explore, discover new things, get different ideas, get different perspectives, right? We want people to come into medical school to have various perspectives. If you guys are all just focused on health, then you might not be focused on the bigger picture. So understanding how different perspectives, different interpretations, different critical thinking skills are really going to help build and create that larger structure that you can then use when you go to medical school. So you don't have to be, there's no opportunities in any of the hospitals or any of the universities that study any sort of health component, you can still do research in whatever field. It's just, those are the skills. Those skills you're still going to use are going to be valuable to you later on anyways.
Yeah, and actually, assuming you can still hear me, I'm having some trouble with Zoom. I have a second question from I have a second question from one of the online attendees, which is, as a medical student at the UAA campus, this would be a first-year WWAMI student, are the research opportunities only in Alaska Anchorage?
No.
In the first summer of there's a bit more to the question before you jump in, if that's okay.
Okay.
In the first summer of medical school, are there opportunities for a summer research project throughout the WWAMI region? And they're referring to summer quarter 1 of medical school.
Yeah, so I often suggest students not get engaged in research until they've fully felt comfortable with the WWAMI curriculum. It's a lot of information at once. We go super fast. So I tell students not to fully engage and take on more than they can chew, right? So don't dive in once you get into medical school. If medical school is easy and you think that you can do research on the side, then that's always a potential, right? So you can always engage. I have 1 or 2 students that do it every year that ask me every year in July how they can start research. But yes, so students can start working with people in Seattle, throughout the WWAMI region. Students have access to all the different research opportunities throughout the WWAMI region. We have direct projects that we work with the CDC, Alaska Medical Center, here at UAA, various places in Alaska, and other doctors throughout Anchorage that students can also work with. But they don't have to work with just people in Alaska. There's a lot of students go to Seattle during the summer between the first and second year to do research as well. And then with the clinical translational research pathway, the idea is students to engage in research for all 4 years. So it doesn't necessarily mean that you're working on research 40 hours a week. It could be variable, and a lot of the students will engage with researchers that they can do the research remotely. So you can work a little bit here and there on the project those 4 years, or potentially have a bigger role your 4th year in the project and go and present at conferences and publish papers and stuff like that. So that's the goal. A lot of our students were really wanting that to be a little bit more competitive for the specialties. And so we've sort of developed a pathway that help build that and continue their growth. So great questions. I'm assuming I'm gonna get kicked out. I didn't even look at the schedule. Oh, you guys have lunch. Any other questions? Yeah.
Ask about high school, what
Yeah.
kids can do.
In high school? I think it's having strong foundation in sciences is important. So taking as many science courses as you can, potentially AP classes. I don't even know what they offer now. Might be what there's all sorts that are coming in here and taking courses. We have students that our middle college students that come and take courses here. That's one way to network and interact with professors, finding, or like Shreya did with me, finding me and saying, hey, I want to work, and then coming and showing up consistently. So yeah, I think for students just to engage in research, to take advantage of every opportunity. I always tell students, if you don't take advantage of the opportunities, you're never gonna get it, right? So always apply for different programs, for different opportunities, challenge yourself. In science, we fail all the time. We learn from failure. Science, like students laugh at me because like every experiment, there's always something that goes wrong or potentially goes wrong, and we learn from those experiences. And sometimes those failures lead to discoveries. And so as a scientist, you have to embrace those failures and take advantage of all those different opportunities and grow from them. So as much as you can do and build without taking on too much, I think some students these days try to bite off more than they can chew. And so also having fun while you're doing it and enjoying what you're doing, I think is the biggest thing. So.
Just as a follow-up, you know, a lot of the things that I heard you talking about are very based at people coming to the university. For kids who are in rural areas, are there opportunities that, you know, connect them with researchers, you know, maybe online?
Yeah. Online, it's hard. So one of the things that we do, we just got, hopefully we'll continue to have, the human health service, through the Indian Health Service has provided grant funding for the Delakeets program that brings in students from off the road system to UAA and gives them an experience. One of the things that we would like to build into that is also a research component. That's what we had done traditionally in the past. I worked with students in the lab and went through that program years ago. And so that's one way that we're hoping to potentially get students. We've added funding to the Alaska Embry program with Illisavic College and Barrow. So we're hoping to get those students either to Fairbanks or potentially find a way to make it remote that they can participate in research as well. We're trying to, it's really difficult, but we're trying to make those opportunities available because we know how important and significant they are for students. And I know I have a couple of Delakeet students here too. So, yeah. And I think we
Holly,
have
I have another
go
online
ahead.
question.
Yeah.
So a student or an online attendee who's asking, would you know of any research opportunities for rural high school students, or does it have to be in person?
Yeah, I would say that applying to the Delakeets program is really cool because, and I could have students, I'm not going to put you on the spot, but I can have students talk about it. That it's a 4-week experience for students to kind of engage and see what it's like to live on campus, as well as studying a curriculum that is really engaged in health sciences and focused. So we actually had students for a week in our research lab. And so they got a taste of research. Some of them liked it, some of them, it wasn't for them. Research isn't for everybody. It's challenging. You got to use your critical thinking skills. You got to start to think of, why am I doing what I'm doing there? How is this going to solve this problem, right? So that's probably the best opportunity for students is to look at the Delakeets program. And I think we had the record number of applicants this year. So I'm hoping we have funding now for dedicated spots. We've had various support through Native communities that have helped provide funding for additional students. I know the Matsu Health Foundation has provided some money and supports that program. So we're trying to build that program so it gives more students opportunities. Because we actually see students succeed and get to where they want to be, have really good success. And Ian Van Tats, who's online, is the one who started that program and is an advocate. So Ian probably could tell you more about it, but yeah, it's a great program for students that are in rural Alaska.
Where do we find out about that?
Online, it's on WWAMI, yeah. On the WWAMI website. Okay, you guys can go to lunch. You don't have to say, thank you so much. I really appreciate it. Thanks so much for taking your time to attend the talk. I appreciate it.
Okay, I believe I'm just talking to the online group at the moment. And we're scheduled at this point while everyone in Anchorage has lunch to have advising. I'm having some issues with my own Zoom, so I may look at my audio is working, but not my videos come on too. But we have this time while everyone in Anchorage is enjoying their lunch break, and you're welcome to eat and drink at the same time. I'm not going to be remotely offended. I'm not there with you. I'm going to eat and drink too, as I feel inspired. If you have questions about med school that have come up, now's your chance to use me as a tool for question and answer. As Dr. Martinson said, I was involved in the Della Keats program for many years, and also the affiliated research programs that were involved. I'm not running it now. I've headed it on to others. I've also been doing pre-med advising, both for high school and undergraduate students for many years. And I am a professor. I teach physiology as part of the undergraduate program at UAA with the College of Arts and Sciences, their biology department. And I also teach various physiology topics as part of first and second year med school. So I'm familiar with both undergrad at UAA and the med school curriculum as one of the people who teaches in it. So really, it's one of those things. You can ask me a question about anything. I'll try to answer. If I don't know the answer, I'll get back to you. But feel free to jump in.
I did have a question about kind of like talking about like the personal statement or personal comments. How do you go about like starting to write something like that? Because it's not a lot of space, it seems like, to hit a lot of different things. Okay,
that's a good question. And I'd really emphasize what Dr. Yee mentioned earlier, the UW admissions officer or director, that what they're really looking for is that reflection. So the way I would approach it, first of all, there are two different things. So I'll start with a personal statement. How I would approach the personal statement is the prompt that you get from AMCAS or the applications people is something like, why do you want to go to medical school? And if you write an essay on why I want to go to medical school is because I think it'd be intellectually stimulating and I've always wanted to, that probably wouldn't go down very well. What you actually want to do is in your mind, change the topic to why do you want to serve patients as a physician? So keeping it personal, so I'll do that again. Why do you want to serve patients as a physician? And then I would write an essay in a and I wouldn't do the sort of thing that people ask for in English class with an amazing hook and great literary achievements. You've got an admissions committee made up of doctors and healthcare professionals and professors. They want a simple, straightforward account of that question. They want to see that you have a desire to serve. They want to see that you actually are interested in patients and not just a career for yourself. And they want to see that you're interested in serving them as a physician, because there are many different ways you can serve patients. You can serve them as an interpreter, as a nurse, as a janitor, as a lawyer. There are lots of ways you can do that, and they're all quite valid, but you're asking to go to medical school. So, and then if you can track that, and there are different ways of doing it. So an introduction, fairly short, that sets the tone and explains what you're going to talk about. And then probably about 4 paragraphs, so you don't have a great many words, that follow in some sort of logical sequence, probably chronological, that gets to that why you want to serve. So it might start with some personal experiences, then it might build to patient interactions, then it might build to interacting with physicians, and then you wrap it up with a conclusion. That's how I would strongly recommend writing that personal statement. Now, and within that, I would, because of it's the why do you, it's really nice to illustrate key points with a small personal example of an interaction with a physician, of a patient interaction, of a personal experience. So it doesn't just become something that an AI program could write off the internet, but it really is what you lived, and people have that. So that's what I do for the personal statement. And I think if you follow that, you'll come pretty close to the word limit, and then there's some fine tuning to make it fit. I would also very much recommend running that past somebody else before you submit it. We do have at UAA, the Learning Center in the library has people who will review personal statements. But if you're not at UAA, and obviously a lot of people aren't, at other universities or just simply a friend could look through it and you just tell them the topic and ask if that's been communicated. You'll also find that just simply editing, almost everything you write, you can shorten it if you need to. So I would write the thing and I would not worry if it's about 200 or 300 words too long, because you can always trim that out somehow once it's down. And then for the 15 experiences and achievements, again, it's difficult because they're very short. You have 3 that you can write a bit more on. And so given the topic and given what you're trying to do, I would ensure that at least one of those enables you to reflect on the role of a physician or why you want to be a physician or interactions with a physician, because that really emphasizes what you're doing. The other 2 could be on other things, but at least one of your most meaningfuls, make it something that enables you to do that, because that gives you the space to do it. And then for the others, I would sacrifice facts for reflection to make it fit in. So for example, if you were writing a short thing on volunteering or maybe you're writing a short thing on shadowing a radiologist, instead of writing that you shadowed a radiologist for X amount of hours and there was a radiologist and their nurse and you got to play with 6 different types of equipment and use your space with that, write something along the lines of, I got to shadow with a radiologist, Dr. So-and-so, and in the time that I spent with them, you might still put in the hours, the time that I spent with them really reinforced the importance of teamwork in medicine. And then you use an example talking about that. So you've still told people that you shadowed a radiologist. You've told them how many hours are there, but what you've really brought in is, this is the key thing I learned from that, and this is an example of how I learned it. And that's much more important than what toys you got to play with. So that's how I would, if you're making a judgment about how to balance use your words effectively, that's where I would go with the words. Does that answer your question, Shannon?
Yes, that does. That's very helpful. Thank you.
Okay, and thank you. It was a good question, because it's something I really want everybody to be aware of, because obviously doing those 2 things well is going to set you apart in the interview, or set you apart as an applicant. And I guess the other thing going with it is, if you remember back when they have the interview, again, this is sort of like the pop quiz on the talks you've just had, you have the 3 people sitting in on the interview. Only one of them has seen your grades, but all of them have read the personal statement and the reflections. And obviously they're much more personal than numbers. So they have those 2 elements have a big effect on how people see you coming into the interview, and a big effect on the types of questions they're going to ask you on the interview. So nailing them is really important. Okay, does someone else have a question? I can see about 20 people online. Everyone's probably just dashed off for lunch. Shannon, you're allowed a second question if you want.
Yeah, I actually have
Okay,
another
sure.
one too.
Go for it.
As far as like funding your medical school education, are there things like scholarships or things like that help with it, or is it mostly financial aid? I'm just not really sure what that looks like.
Okay, that's a good question, because money is important. And certainly a big motivation for finishing your MD, because the MD program is expensive. And if you are able to gain employment at the end of it as a physician, that makes paying it back a lot easier than not finishing it. Most people going through the program, it is student aid, and it's relatively easy to get. Certainly with our program, UW School of Medicine has a specific office in financial aid that deals exclusively with medical students in the WWAMI system. So they have an office with 4 or 5 people who are just there for you in this program effectively, or just for the people in the 5 states. So you have good student aid support. And most of that aid, again, I'm not originally from America, so I find it rather odd sometimes that most of the aid isn't really aid, it's loans. Some of it's real aid, so some of it's actual scholarships that are available. And that would depend, again, especially if you're come from a financially challenged background, there's more of that. Now, on the other hand, there are scholarships available. And with Alaska WWAMI, in the first year, you're officially enrolled at UAA, so you're eligible for a number of scholarships through the University of Alaska Anchorage. Also, if you come from, there are also various local ones in Alaska. So Mat-Su Health Foundation has scholarships to help students who come from the Mat-Su Valley. Many of the rural parts of Alaska, so for example, North Slope Borough has money to help students who come from North Slope Borough, etc. So there are lots of little bits and pieces that you can apply for. And then second, third, and fourth year, you're enrolled through University of Washington and you're eligible for the scholarships that are available there. Now, I don't think there are any, the university itself doesn't offer any full rides that get you all the way through. So these scholarships are generally small fraction. They're still substantial. It's a $2,000 or a $5,000 or a $10,000 scholarship, but there aren't any in the hundreds of thousands. Almost the best one you can have is simply if you have a family member who's faculty or staff. If you have a family member who's an employee at UAA, you can get a tuition waiver for the first year. So if you can persuade a family member to go and get a job at UAA before you apply, that's actually worth a chunk of change. Even if it's a terrible job, the lowest paid job will get you a decent tuition waiver. I probably shouldn't be recommending this. Okay. The other side for that is there are various organizations that will pay for your medical school in return for a commitment. Unfortunately, there's no such thing as a completely free lunch. Probably the best known of those is the Defense Department, that there are various military programs. And obviously the flip side to that is you actually have to go and serve when you finish your degree. I remember going back some time ago before all the issues blew up in Afghanistan and Iraq. It was quite a shock for some people who had medical, the army was paying, and then suddenly they had to go and serve, and it was a bit of a shock for a few people, but obviously that goes with it. But we do have students who do that, and if you genuinely want to serve, then I would recommend that. I served myself in the Australian Army, so I'm certainly sympathetic. The other organization that a number of our students often get a full ride from is the Indian Health Service. Again, it takes a commitment. Typically, you have to do your residency or some years as a physician afterwards. You sign a contract and they'll cover your tuition to do that. Again, if that's already your aim and you want to come back to Alaska and work in the Alaska Native Medical Center or with Search down in Southeast or something similar, well, someone's giving you a fellowship to do what you want to do anyway. That's perfect. So those things exist. And actually to support that, we actually have a pathway within WWAMI for students who want to work with Alaska Native and American Indian communities. But beyond those, so there are full rides that are available if you're prepared to sign on for something along those lines. Otherwise, there are small scholarships available that the University of Alaska and UW will help you with. And then other than that, it's student aid. But again, when you come out the other end as a physician, again, it's a fairly remunerative and employable position. Often the other way people get things paid off is as a signing bonus, and particularly if you're working in Alaska. So for example, you go through medical school. I think of an example, I have a friend who's an anesthesiologist, went through medical school, went and did residency as anesthesiologist, wanted to work in Alaska, and ANMC, as part of this contract, basically paid his med school debt as a signing bonus. Again, it's unlikely anybody would do that to recruit you to Texas or California, but for Alaska, there are Alaskan hospitals that will pay signing bonuses for specialists. It's just part of that initial contract negotiation. So you accumulate the debt through student aid, but you negotiate it away when you sign up. But for most people, you do accumulate that debt and then have to deal with it somehow. So it's a good question. Money's a big thing. I guess also with the money, I think Dr. Young mentioned with WWAMI, you're paying resident tuition, but the state is covering the non-resident tuition. And so you're expected, if you go through WWAMI, either to come back to Alaska and work, and that could be as a resident or post-residency, or if you go out of state, then that would be an extra expense that you would have to reimburse the state for, that difference between resident and non-resident tuition. But they don't come chasing people for that. I mean, that doesn't appear as student debt because it's assumed that you're a resident up until the point that you finish all your residencies and fellowships. And when you finish all of that, that's when the state comes and knocks on the door and says, by the way, are you coming back to work in Alaska? What's your plan for doing this? And they give you a number of years to do it. It's not that you have to reach into your pocket immediately and pay it. And if you've done your residency in Alaska, you've already knocked off 3 years or whatever out of that requirement in any case. Okay, does someone else have a question? I see Noala, you've appeared. And Erin?
I was hoping to ask about essentially if you feel like there are resources or community for Alaska Native or Native American students, both on the UAA campus and at UW in general.
Yes, there are. I think pretty much every class that well, first of all, you will have classmates. I think every class that I've been involved with at Alaska WWAMI has had one or more, and usually more, Alaska Native or American Indian students in that class. Then, as I was just mentioning expanding my answer to Shannon's question, we have within WWAMI, there are a number of streams that you can take part on to get basically it's an extra line on your MD degree. So there's a program there for students who want to, who are interested in getting extra experience working with the LGBTQ community. There's a stream for students who are particularly interested in working with the Hispanic community, although you have to speak Spanish to be in that. And there is a particular stream for students who want to work with the American Indian and Alaska Native community. And you don't have to be Alaska Native to be in that stream or American Indian, but many students are. And that's tailored particularly, there's some undergraduate classwork, sorry, not undergraduate, first and second year med school classwork that students take part in if they are in that stream. And then in third and fourth year, students in that stream are expected to do and get priority for residencies where they're working with American Indian or Alaska Native communities. And it's strongly encouraged, I think it may even be compulsory, that students who are doing that will do, if they're from the 4 non-Alaska states, that they will come up to Alaska and do rotations here to see how the Alaska Native healthcare system works, because it's quite different. And equally, students from here who are in that program will go down to the lower 48 and go to Montana or Idaho and work with an IHS facility. So it's almost a chance to see what it used to be like before the Native corporations started funding and running things. It'll make you feel very good about the Native corporations. But to get that shared experience. So that's certainly there. Then within that, at UAA, there's a Alaska Native Students Association where students meet with each other and tutors and can support each other. And then within UW School of Medicine, there's also an American Indian Alaska Native student organization where people can meet and support each other and discuss things. So those supports are definitely available. And then just within that is, even within the first and second year curriculum, with the clinical rotations, one of the things we really try to do is expose students to rural Alaska, which inevitably involves exposure to Alaska Native communities and working with Alaska Native patients and nurses and physicians. Certainly in that first summer that students have, they're required to go out and do a clinical experience in rural Alaska. So that is a portion that's, and again, that's for everybody. Everyone has to do that. And then people come back and share their experiences. So I don't know if it's a perfect support system, but that's how it pans out. Does that help with your question, Erin?
Yeah, that definitely helps. And I was I was definitely wondering about if there are any Native students in the program, because I know that there are many Native people in Alaska. It's nice to hear that there are at least some.
There are at least some. And again, the program is open to anyone who is an Alaska resident. But of course, as part of our system, we're really focusing on people who are genuinely, who have real ties to Alaska and are genuinely committed to staying and working in Alaska. And of course, there are many different ways that people can communicate that, but it's if someone is from an Alaska Native background and has close ties to the Alaska Native community, that's a very easy way to demonstrate that you're serious about staying in Alaska and serving Alaska in general, the Alaska Native community in particular. But yes, I think it's yeah, I'm just trying to think. I cannot think of a year that I've been involved in teaching where there has not been at least one Alaska Native student in the year. And again, usually it's been more than one, which is also nice because nobody wants to be the one person in a program.
Yeah, it's hard to have community to being the one, but I was also wondering, your answer made me think about this. Like, there are so many pathways, and I love that UW offers them. But it sort of seems like it's taking on additional workload. And so I'm wondering, is it expected or just possible, I guess, for a student to choose one pathway? Or if somebody was interested in Indian health pathway and research?
Okay, first of all, you don't have to choose any of those pathways. So they're optional extras. You are required to do some research. You are expected to do clinical experiences. That's just part of the normal program for everyone.
Right.
It's if you want to take on one of these pathways as an extra pathway, then that's an extra thing. It's not a great deal of extra course, but it's only one extra course. But it would be unusual for someone. There undoubtedly are people who do 2 or 3, but most people don't do any, or they just do 1. It's much more normal just to do 1. Because part of it is we want you to succeed. And med school in general is a lot of work. We want you to be able to keep up with the core curriculum. We want you to be able to nail those board exams or licensing exams when they come through. And you can't do that if we've buried you under a ton of extra coursework. So those extra pathways are there for people who are genuinely interested. And again, doing one extra pathway that you're generally interested probably makes med school more interesting, and it helps to motivate you so you succeed anyway. And it provides you with a support group. If you're doing the Alaska Native American Indian pathway, you're meeting regularly with people who are interested in that. If you're doing the Hispanic pathway, you're meeting regularly with Spanish-speaking people who are interested in that. And that presumably helps to build a community of motivation. But it's not expected that you don't have to do any, and it's certainly not expected that you do more than 1.
Thank you so much.
And I was also adding is that you're not isolated just in your own year. So even if you do come in, and let's say we had a year where there was only 1 Alaska Native student in that year, well, they'll still be mixing with the second years. So you'll have some mentors the year ahead. You'll have 3rd years and 4th years. There is a broader community than just 1 year of students. Okay, I think Shannon, did you have a question for me?
No, I'm good. Thank you.
Okay, it wasn't clear. Okay, does someone else have a question?
I have a quick question.
Sure.
Sorry, my lighting's super weird in here, but I was wondering how the program views super non-traditional students who might be taking classes post-undergrad, and the best thing those students could do to stand out as applicants, or to make up for perhaps a different background.
Well, first of all, there's no need to make up for a different background. And to some extent, non-traditional students stand out because they have other experiences that they can write about. So I guess your strength as a non-traditional student would be when you get into that personal statement and 15 experiences, you're likely to have a broader set of experiences than a traditional student, because you have done other things and you have a diversity of things and you have a diversity of letters that you can draw on. So what you want to look at is when they're looking at applications, first of all, you want to make sure your personal statement is well written and clearly articulates why you want to serve patients as a physician. Secondly, you want to make sure those experiences that you write about cover a diverse range of elements and are supported by personal examples and you've learned something, they're reflective. And then with your courses, in terms of you want to do well in the MCAT exam, because obviously your science courses may have been some time ago, and the MCAT exam is a way of demonstrating that academically you're on top of those subjects and that they don't have to worry about whether or not you can handle licensing exams, because if you can handle the MCAT, you can handle those. But generally the way you would stand out is not by trying to not by trying to put yourself back into a box that you're not in, but rather pointing out how you have learned about medicine, how these other experiences that you've had have really confirmed your desire to continue on to medical school, have strengthened your ability, and have given you other skills, that you have skills maybe in leadership, you have skills in professionalism because you've worked in a work environment. Maybe it demonstrates resilience, that you've stuck with things going through. So you'd want to get letters of recommendation from people who can attest to those things. So it's not just you saying, I am resilient or I am a good team player. You have an employer or you have other people who can help with that. But I think, as I mentioned to some other people, we get this mix of applicants coming in. We have a mix of people in the class. We want a variety of people from a variety of different backgrounds. I'd say at least half of our successful applicants in any cohort are non-traditional students who are older. So it's not that you would be unusual. It's just how best you describe the things that you've done. And also just simply making sure that you do the core things well, that you have met those prerequisites and that you have done relatively well in the MCAT. I mean, we're not expecting you to knock it out of the park if you've been out of school for a long time, but it is a nice way of demonstrating that you have that academic test-taking skill still. Does that help, Ariel?
It does indeed. I appreciate it.
Yeah, and I'd also add, both for you and for everyone else, some of these things are things that myself and Dr. Affenbeck can help with. We regularly, if you go to the UAA advisors, pre-medical advisors website, there's a link there for both of us just to simply schedule an appointment to meet and talk by Zoom privately. So you can have a half-hour appointment. And when students are in that application process, they regularly meet with us. So when someone's, say, a year out from applying or in the process of doing things, we'll meet to talk about how to prepare for the MCAT. We'll meet to talk about how best to approach the personal statement. We'll meet to talk about how best to do the interview. You've never practiced interview. And if I have a spare space on my calendar or Dr. Affenbeck has a spare space on the calendar, you're always welcome to just jump in and do that. And we're happy to help at any stage of the program. So you hear all these good things at a pre-med summit. When you're actually coming time to apply them, absolutely feel free to reach out and just touch base with either of us. And we'll happily talk through these things with you privately for half an hour. And it's one of those, we want everybody to apply to put their best foot forward and do their best.
Thank you. I might sign one up. I appreciate it.
Yep. Yeah, we can sign one up for next week if you want. Okay, I don't see anyone on camera, but you don't have to be on camera. Does anybody else have any questions for me? Okay, then what I'll do is I'll wrap up there because our pre-med coordinator, Elida van Almelo, is walking people through the informational tables. So I'll pass you to her and let her do the walkthrough now. Okay, so Elida, if you're listening.
Yep. Hi, everyone.
Okay.
So I'm here at the in-person summit right now, and there's a bit of background noise, so I'll just ask you all to bear with me. But we're going to go take a quick tour of our informational tables. And so we'll have each table host share a brief spiel of what they're here for, what they do, and what they're representing. And then if anyone has questions, you could feel free to ask. So let's see. Hi, Daphne. Do you mind giving a spiel to our virtual summit? Okay, so here we go.
Okay. Hi, everyone. My name is Daphne. I work in the Office of Admissions. I'm kind of that first step when you start your journey here at UAA. That's pretty much it. Yeah.
And then, so if anyone has any questions for UAA admissions, feel free to ask. Oh, that's a response. Okay. Thank you. Thanks, Daphne. Okay, let's see. Next, we're gonna go and meet. Hi. Hi. It's going well. So I'm here with our virtual summit. This is our Pre-Med Society Club. I'll show you the whole table. Okay. And so if you want to share anything about who you are and what you're doing, and then the virtual summit can do a quick, they can ask questions if they have any questions.
Sure, we'd love to.
Yeah.
Hi, I'm Logan.
And I'm Addison.
We are Pre-Health Society. We are a student-led organization on campus, hoping to get as much involvement on campus, as much networking, to get shadowing opportunities for students, volunteering opportunities, and just try to make a society where people can come together and help each other out, really. Do you have anything to add?
Yeah. We have a lot of volunteer opportunities, a lot of shadowing opportunities, really good speakers that we're planning at some point.
Yeah. We have national and local volunteering. I guess we should mention. We have national with the NMDP, National Marrow Donor Program, to try to help patients find matches for blood cancers like leukemia and lymphoma. And then we also have local with Brother Francis Shelter. I don't know if I should look at you or the camera, but I'm gonna go back and forth.
Yeah.
But
about the same thing.
the Brother Francis Shelter is also another one, the foot clinic specifically, where you go in and help homeless people or people struggling with homelessness take care of their feet and just help. So yeah, if you have any questions, please ask away. Oh, is Pre-Health Society a student club for UAA students only? It is a student club at UAA, but it is not for students only. It's for anyone who's interested in joining. Yeah.
So it's not exclusively UAA students.
Yeah.
So
no.
anyone. Okay.
Yeah.
That's great. Yeah. Good to know.
Yeah. Thank you so much. I think that was the only question. Yeah. There's only one.
Yeah.
Okay. Well, thank you very much.
Thank you so much.
Okay. All right. We're going to move on over here. Hi, Jessica. I have the virtual summit on right now. So this is one of our current WWAMI students, Jessica, and she's here. She can give you a quick spiel about Alaska WWAMI. I'll put you there, and then if anyone has questions, they're putting them in the chat, or they can ask them out loud.
Great. Can I open the chat?
Yes,
Okay,
definitely.
cool. Love it. Hello, I'm Jessica. I am a current fourth-year student. I just applied into general surgery, and I have so many positive things to say about WWAMI. I think one thing it really excels at is building a community. And so I went to UAA for undergrad, and so getting to continue to work in the community and serve the community that showed me that I was meant to be a physician is one of the best things about going to WWAMI. I love that you get to travel to all of the different states for your clinical rotations. You get to meet people. You get to see how different healthcare systems practice medicine, and something that's really unique and really special. Cool. That's my little spiel.
Okay.
Did I take a gap year? No, I did not. It's one of the biggest regrets I have in life is not taking a gap year. Medicine will always be there. Medicine will wait. And there are other things. You have to remember who you are outside of medicine. And so I think if I had taken the gap year and I had taken the time to explore those things, I think that is something that would be really beneficial to me. And medicine's a really long journey. And so I think that I always knew I wanted to be a doctor, which is why I was in, I guess, such a rush to get into medical school to start. But ultimately, I think my colleagues and my friends who took the gap year overall were much more well-rested at the start of medical school than I was. And so I definitely think that medicine and medical school will wait. And I think everyone should take a gap year before med school. That's my take on that. Where are you in your training and education? So I am a current 4th year student. So I am about 3 months away from graduating, which I'm really excited about. So I start residency this summer and I will be starting in general surgery. Match day is next month, so I don't quite know where I'm going yet. How do you balance life with the load of studying? Has it been manageable? It's definitely manageable, and I feel very strongly that you have time for the things that you prioritize, and that it's really important to prioritize things outside of medicine. Because ultimately outside of medicine, we're all still people, and it's your hobbies, it's your friends, it's your family that ultimately are going to help you get through this very long journey. And so making sure that those things are also a priority in your life is really important. It's definitely a transition, and there's definitely an adjustment period when you first start medical school and you're kind of figuring out what that balance is. And I will say, I feel like that was one thing that my friends that took gap years were a little bit faster at figuring out than I was, is where that balance was. Which is again why I definitely recommend taking a gap year. How is the pace of medical school compared to undergrad? I would say that for the first 2 years of medical school, so your preclinicals, when you're in the classroom learning, which is not unsimilar to undergrad, the content that you are learning is relatively similar to what you're learning in undergrad in terms of difficulty. I would say that it's not any more difficult than what you're learning in undergrad. The difference is it's coming at you a lot faster. And so it's just a bigger volume of the same sorts of information. And again, definitely an adjustment period to kind of figuring out how can I learn this quickly and how can I learn this efficiently? And that's going to change depending on kind of what block you're in, what it is you're specifically learning. There are some resources better suited for other blocks that tend to be more rote memorization than blocks that are really conceptual based. And I feel like the first 2 semesters of medical school are definitely kind of figuring out what works best for you.
Maybe one more question.
Yeah. Perfect. That might have been it. That's great.
Okay, thank you so much.
Yeah, thank you.
Appreciate it. Okay. Let's see. I'm looking for a table that has an opening. Here we go. She's great. Hi, we have our virtual summit here. So here I'll get a full view of the table, and then I'll let you introduce yourselves and talk about why you're here, and then folks are putting questions in the chat.
Okay,
so if
great.
anyone has questions. Yeah.
Well, I love that we have your computer on wheels here. I'm Kristen Stepler. I'm an assistant professor with the Division of Population Health Sciences. I'm also serve as the chair for the Health Sciences undergraduate program. Let's turn it a little bit here so you can see Eddie.
And I'm Dr. Eduardo Piqueras. I teach in both health sciences and public health, so undergrad and the graduate level.
And so we're here today because we serve as one of the pipeline programs for all of our clinical graduate programs that we have partnerships with. So the health sciences degree has a preclinical track that allows you to really build a really great foundation in public health. You understand how the health activities. Echoing for some reason. Oh, maybe it's okay now. Okay. Sorry, folks, we were echoing there for a moment, but so you'll build a really good foundation in understanding how the health of communities can also impact the health of individuals that you might serve later as patients or clients. But in the preclinical track, we'll make sure all of your prerequisites for your clinical graduate programs are included. And not to mention the fact that we have a really small faculty network, so you get a lot of one-on-one time with your faculty, and you can also engage in undergraduate research opportunities as well as community engaged learning opportunities as well. So we hope that if this is an interest of yours, you'll reach out. And I think that we are in the program as well, right, for contact information?
Yes.
Okay, great. Oh, the question was, what are our names? So I'm Assistant Professor Stepler, S-T-O-E-P-L-E-R.
And Dr. Piqueras, Piqueueiras. All the vowels.
Yeah, and I can also send, I'm going to send slideshows
Okay.
after the fact, and so I'll make sure that folks' contact info is also in there.
Wonderful.
Anyone else have any other questions?
Okay.
Thank you so much for stopping by.
Thank you, yeah.
Appreciate that.
All right, and now right next door, here we are with the School of Pharmacy. And so I'll have you introduce yourself, and then folks are putting questions here in the chat if they have any.
Okay.
And then you.
All right, so my name is Linda Jackson and I work for the College of Pharmacy. I'm based out of our Idaho State University campus in Pocatello, but we have an entire part of our program here. You can do the complete College of Pharmacy program here at the UAA campus because we are partnered with the UAA campus. I also help students specifically who are pre-pharmacy. And so I help you navigate through all the classes that you need to take, the prerequisites and the general education requirements. And some of our students choose to just join the Doctor of Pharmacy program right after finishing those prerequisites and the gen eds before finishing their bachelor's degrees. So if you're interested in that, if you're interested in the potential of becoming a doctor in 6 years, specifically a doctor of pharmacy, you can let me know, Linda Jackson at isu.edu, and I know my contact info will be presented as well to you. And I'm normally on the Pocatello campus, so if I'm not where you are, we can Zoom and make sure that we make contact and I help you with the things you need to get into our program.
All right, any questions?
Any questions?
Okay,
Great.
thank you so much, Linda. Okay, next up is the MEDEX Physician Assistant Program, and this is Elizabeth. So I'll have you give your spiel, introduce yourself, and then questions are coming up.
Okay, perfect. Hi, my name is Elizabeth. I work for MEDEX, which is the Physician Assistant Program. So it is a master's program, which is through the University of Washington, but we are housed here at UAA if you'd like to continue staying in Alaska. We also have sites in Washington and also Hawaii. So a physician assistant, if anyone is unaware, is a medical provider similar to a doctor or a nurse practitioner. So you'll be diagnosing patients, working in clinic, and then you can also work in the ER or pediatrics. So you can specialize in what you desire. But let me actually give you, so I don't know if you can scan this, but this is the QR code to our website. And if you have any questions, I'm more than happy to answer any. I am watching the chat, but yeah. Oh, okay, perfect. Yay. Yeah, no questions.
Okay.
But it's nice to talk to everyone.
Thank you so much. Okay.
Oh,
Now-
Elida, before you disappear, I did have a question. We had a question, I
Okay.
just typed it in for the PA program.
Perfect. Okay.
Oh, we just had a question before during one of the presentations, they were asking about how a career as a PA might differ from a career as a physician. Is that something you'd feel comfortable answering?
Okay. Gotcha. Yeah, I could try and answer that as best as possible. So there is a lot of similarities between a doctor and a PA. I will say like one of the big differences, not as far as career, but schooling. So PA is less schooling than a doctor. But I think one of the big differences as well is that a PA can specialize in multiple areas. So if they want to specialize in pediatrics, orthos, or if they want to change it up, I feel like it's a very flexible degree. So let's say, for example, you're working in pediatrics for an odd number of years, but then you're like, you know what, I'm kind of bored. I'd rather go to the emergency or ER field, and you can do that. So it's very flexible. And let's see what else. I feel like that's the best description that I can give so far. Can PAs travel independently without? Oh yeah, so I can give this an example within our program. So when you enter into our program, you are expected to travel at least for schooling. So we may send you to Las Vegas or another state to complete your clinical. So that's part of traveling as far as in the program. I hope that answered your question. Yeah, so that would be during your in the program during your education, because it's 2 quarters didactic, and then after your didactic you're immediately in clinic. And so there's all different sites in clinic, so again it's in different states, so you could leave Alaska and go to one of the sites in the lower states. I hope that answered your question. No, I don't think there's anything else.
Thank you again.
Thanks, Elizabeth.
Okay. We are moving on to the occupational therapy program, which is hosted through here by way of Creighton University. And here are some of the current students to talk about the program, and we can also rotate it around. And then anyone that has questions, or just putting them in the chat.
Okay, great.
Yeah.
I'm Lexi, this is Christina, and this is Jessie. We're all occupational therapy students at the moment in our second semester. So yeah, this program is by Creighton, which is in Omaha, Nebraska, but they partner with UAA. So we all live in Alaska, we're all here. We don't have to travel like to Omaha or anything like that. But yeah, occupational therapy does anyone else want to, sorry, I feel like I'm talking. Anyone else? Go for it. Okay. So occupational therapy, we look at, it's a very holistic practice. We look at the whole person. We can kind of see any patients ranging from newborns to hospice care. We look at the specific activities that they enjoy doing or that they have to do throughout their daily life, and kind of getting them back towards independence. So it could be someone who had a stroke and has complete loss of their right side of their body. We could be, well, that's my left. We could be looking at, how they're going to eat, how they're going to, brush their hair, bathe, how they're going to prepare food. It's a very broad range of things that we can do.
And I know you guys have probably seen a lot of the other tables that have information about more medical programs. So occupational therapy is kind of related to the medical field, but within specifically allied health. So it's going to be allied health being like physical therapy, occupational therapy, speech pathology. And so we do work very closely with medical providers like PAs or MDs. So we kind of work that interdisciplinary team working together. OTs, like Lexi said, can work a lot like in hospitals, but they can also work in outpatient, and really kind of any age, anybody they can work with. So that can range from infants to school age children to our older population, anybody in between, and all kinds of different diagnoses, because it really looks kind of at that big picture of what are you trying to get back to doing, what are you struggling with, and helping people regain their independence.
And this is a QR code. I don't know if you guys are able to scan it, or you can, so you can see the website there. That'll have more information.
And next week I'll be sending out information.
Beautiful.
So, but that's
Private practice,
So OT
yes.
can work in private practice, and there's actually within Alaska, there's a lot of private practice clinics specifically in pediatrics. But there's also ones that can do hand rehabilitation or hand therapy. So yes.
Yeah, there's a lot of specialties that you can go into too. Like you said, hand. There's hippotherapy where you actually work with horses.
Really cool.
Yeah, it's very interesting. We're all super excited about that.
That can be
Yeah.
like also a wide variety, like pediatric. So that can be
All the way through older adults.
Yes. We're gonna be really creative with occupational therapy, so we really love it. Once you're in the program, let us know if you have
Okay,
any
I don't see any questions
or if
popping up.
there's anything else you want us to share.
I think we're good.
Okay, well, you might be getting some more questions, or the program might be getting more questions next week. So thank you so much, ladies. Appreciate it. Okay, So we have a few more tables that were occupied earlier that I'm hoping we can go say hi to. Let's see. Maybe I'll. So there are 3 more tables and they all have people at them right now. So I will hop back on in a few when I see that there's one available. Let's see. Okay. So I'm going to turn off my camera for now and mute, but I will pop back on shortly when I see some more of the tables available. So thank you all so much. And as I've been mentioning, I will send out contact information for all of our table hosts programs next week when we're back in the office. Okay, I will be back soon.
Okay, so thank you, Elida. And by my reading of the schedule, we're on a break now until 1. So I will temporarily sign off. And I believe we have a talk scheduled for 1. Unless, of course, Elida hops back on again with more tables.
Okay, there is another table open. I'm going to take you over here to the Alaska Center for Rural Health and Health Workforce. Hi, so I have our virtual summit with us. If you don't mind just taking a moment to introduce yourself and talking about your program. And then up here in the chat, if anyone has questions, they've been putting them up there. So.
All right. Hello, everyone. I'm Janelle Richards. I'm an education coordinator at the Alaska Center for Rural Health and Health Workforce and the Alaska Area Health Education Center. So I mainly provide support and coordinate the Delegates program, which is a 4-week-long residential program here at the UAA campus. So our department in our organization, we aim to support those who want to serve, to get into the healthcare field, want to serve underserved and rural populations here in Alaska.
And so if there are any questions, go ahead and put them in the chat. And
Actually, Elida, can I hop in with a question? Yeah, we did have earlier in the chat, we had questions from rural students or people living in rural Alaska about research opportunities for rural high school students. Does AHEC help with that?
Great question. I don't think specifically for, I would say the Delegates program is a great place to start. It doesn't really, like the focus of it is not for research. It's not research focused. However, there are components of research within that. So if they are interested in healthcare in general, it's a great place to start.
So I knew when I was like 5, when I was like, so, you know, so I like.
Okay, all right. That might be it. Thank
All
you
right,
so much.
thank you so much.
Appreciate it. Okay. And it looks like we're still waiting for those other 2 tables to open up. So I will be back again, hopefully momentarily. Okay, everyone. We have another table available, so I'll zoom out. So this is Catherine with the UAA College of Health. And so I'll have her introduce herself, but she will be able to speak about programs that also aren't necessarily here today. So feel free to ask any questions.
Hello, everyone. Thank you for joining us today. My name is Catherine Pasqua, and I work with our College of Health. So College of Health is one of the units, one of the college units here at the University of Alaska Anchorage. And so I am the student recruitment specialist. So what that just means is that if you are interested in any of the College of Health programs and any of our 45 plus programs, you can contact us, you can contact me, and I can try to help you find the right people or talk with you about about some of those programs. So as Lida mentioned, I work for the College of Health. And so sometimes people are like, oh, what does the College of Health, what kind of the programs that we have? So under our 45 plus programs that we have, that includes like our clinical programs, we have our community and behavioral health programs as well. So that could be like your nursing, some of our health sciences for those who are interested in the pre-med program. We have kinesiology, so if you're interested in sports medicine or program or speech pathologist or being in the medical assisting, nursing. And then we also have our law and justice program. So if you're interested in the criminology, that is also under the umbrella of College of Health. But we also have like if you're interested in nutrition, dietetics, that is also under ours. But we also have like social work or behavioral health programs or human services. That is a part of this big umbrella of College of Health here at UA. Okay, I'm trying to see if there's questions. Yeah.
Okay, so okay.
Awesome. Well, thank you all. We hope that you could join us for the rest of the day. And if you do, feel free to put your questions in the chat and we'll try to answer it for you.
Okay, thank you so much, Catherine.
You're welcome.
Okay, and I am just waiting for this one last table. It's medical assisting for anyone who's interested. And it looks like they still have some folks that they're chatting with. So I'll be back again soon. Okay, everyone, we have our final informational table. And so if you want to introduce yourself and say what you're representing, and then folks are asking questions right here in the chat.
So my name is Cash. I am the program director for medical assisting, and my role here today is to meet with students to let them know that being and applying into WWAMI or MEDEX, it doesn't have to be a straight pathway. That becoming a medical assistant, which again is my job here, is that's the one that she wanted. I guess I'll back up. It allows you the opportunity to get some hands-on experience with patient care, makes you a stronger applicant for the WWAMI and MEDEX programs. But more importantly, it gives you that experience working in a clinic, understanding if you truly want to work with patients. But the soft skill part is that you are now working in a healthcare team. You have a provider who can be supportive and become your mentor as well. So that's my spiel for the afternoon is looking at medical assisting. Our program has external accreditation through the Medical Assisting Education Review Board. So our program is solid. Our passage rate for the CMA certification is about 88%. Nationally, it's in the 60s. So we have, again, a really strong program. We're very supported in the community, and our students are highly sought after. Medical assisting in general is the second largest most sought after profession within the state. Okay, I'm hoping that's good. That's the spiel I've been doing all day. What questions do you have?
How long is the program?
So we have two pathways. We just got Board of Regents approval last year for a 29, we call it an occupational endorsement certificate. So it's 29 credits. If you get your terminology and done before fall semester, then you're in the fall, and summer will be doing a 5-credit practicum, which is hands-on experience within a clinic, and then you'll graduate in August. Most of our students are actually hired within their practicum experience. I get to know my students really well. So I know your personality, I know my clinic's personalities, so I match you up where you're going to be successful. All right. Any other questions?
Okay, it looks like that might be it.
Well, and I can tell you, besides the OEC, the other pathway is the traditional associates degree. If you choose to do the OEC, the 29 credit, all the credits afterwards, 4-year associates are online. So you can work in the clinic and finish your associate's degree.
That's great. Yeah. Okay. Thank you.
So much for coming virtually.
Thank you so much, Lisa. I appreciate it.
Well, Alida, before we leave, I was
yes.
going to ask, just in case people aren't familiar with what medical assistants do, just sort of what sort of tasks would a medical assistant do in a clinic? Someone with an occupational certificate.
Okay, that's a good question. There is a follow-up question. And it is, what sort of tasks do medical assistants do?
So, good question. So if you've ever been in a clinic, more than likely you are interacting with a medical assistant. So if you're at the front desk, we're checking you in. If you're doing clinical, working with the PA, we were just talking with Teresa, you're doing vitals. If the patient is in and has a sore throat, maybe you're doing what we call a CLIA weight test. So you might be doing a throat swab and then testing that throat temperature for what pathogen, virus, bacterial. Then the PA is going to tell you to give a vaccine, maybe the patient needs a booster. Maybe you're going to draw blood. In this scenario with a sore throat, you probably won't be doing an EKG, but you can do an EKG. So we have a scope of practice within the state of Alaska. One thing to keep in mind is that the scope of practices are different from state to state to state. Alaska, we're very blessed to have a wide range of practices and tasks that we can do. We work under the direction of a mid-level or MDD. So we don't take our orders from a nurse. We're working directly for a mid-level or an MD. Is that helpful?
How does MA compare with CNA?
So a certified nursing assistant predominantly is working in a skilled nursing or assisted living facility. They have a narrower scope of practice. We're working in clinics, not necessarily hospitals, but ambulatory care clinics to provide care again, working underneath a MA or MD, DO or mid-level. So nurse practitioners, PAs.
Right, I think that might be
Thank
it.
you so much.
Okay, thanks, Lisa. Okay, thank you, everyone. That concludes the tour of our informational tables. Next week, again, I will send out contact information as well as the links to each of these programs in case you have any follow-up questions. And I think that we are getting close to getting back to our programming. So I'm gonna let you all go, take a little break, and we'll see you again soon. Thanks.
ready, go ahead and grab a notebook and some colored pencils. It is going to be a more interactive session. But if you already have a notebook or something to write with, that's completely fine. You do have your coloring pages in there, and you will want to opt for that. Right. Good afternoon, everyone. Hope you're all doing well and you're full and you're satisfied. I'm Jill Richards. I'm an education coordinator at the UAA's Alaska Center for Rural Health and Health Workforce and the Alaska Area Health Education Center. I'm here with Linda.
Yeah, my name is Linda Hernandez. I am an associate director for the Alaska Center for Rural Health and Health Workforce. We're home to Alaska's Area Health Education Center. Our goal is to really help to improve the distribution of Alaska's healthcare workforce across the state of Alaska. So everything that we do is all making sure that people are aware and to create interest in healthcare careers across Alaska.
And in this session, we're going to talk about turning your healthcare dreams into reality, right? Since you're here, right, you may have an idea of where you want to be, or maybe you're at a place where you're just kind of exploring your options, right? Either works here in this session. Our aim and our goal is to help you with some concrete and tangible steps to achieving your overall goal.
And there we go.
All right, so we're going to start with a really big picture. Okay, so right now I want you to think about what your healthcare dream is. Feel free to dream really big. This is where your journal comes from. If you want to think about what is about the healthcare field that interests you, right? So why are you interested in it, right? Do you want to work with people? Do you want to help people? Do you want to support people? Why are you pursuing this path, right? So right now you're going to think about your why. I want to encourage you to write that down, right? Sometimes it can be really helpful for us to take it to our brain on paper, and that can be like the first step, right? So go ahead and write down your healthcare dream, and if you want to share it, feel free to share it. And those of you online, if you want to put yours in the chat, feel free to do that as well. Anyone want to share what their healthcare dream is? You already have that in place? Yeah.
Mine is to be a physician, most likely in an ER or trauma surgery.
Oh, wow. Nice. Like here in Alaska, or do you want to?
Ideally, Providence.
Okay. Nice. You have a set goal. Thank you for sharing. Anyone else? Cool. You can keep it to yourself. All right. And I also want you to think about what your skills are and what your strengths are, right? And again, if it's something that you're not really familiar with right now, that's completely okay as well, right? But just, it can be really helpful to think about these things because if you have an interest, right? Let's say you want to work with people, but you know you need to work on your communication. That's a skill that you can continue building on. Right? So when you do get into the healthcare field, when you are meeting with patients and supporting patients, right? You have those skills developed or in the process of doing. And something else to consider, what are skills that you are working on? Anyone want to share those? With an heart right now. Yeah.
Hi, I would like to share because I'm currently in the last part of it. I've been in the medical field for quite a while. But as I was going and mingling with people, part of my part I do is the administration part. And I do a lot of the medical billing and coding part. And that also integrates with any kind of healthcare. I think a lot of it, when it comes down to the young people, what I've learned and what I've experienced coming into this field is I'm able to work in both areas, with patient care and non-patient care. I am a purple person, but not a total pro person. You're a purple people person. I'm willing to help people and educate people in the medical field in the insurance perspective part. Some of us may not want to deal with patients. Some of us might not want to even deal with looking at blood or stitching up someone. I've been there, I've done that, I've seen it. I started off in the medical field as a CNA. That is probably one of the best steps that our young generation can start, is start small. You can dream big, but I'll tell you one thing, the medical field is enormous. There are so many things that you can calculate and determine where you are needed in the medical field.
Yeah.
And I'm continuing to work in progress in my current career as a coder and as a biller.
Right.
Because I like to get the perspective of the community. I like to get the perspective of providers. And my mission and my career is to help people not have a huge bill when they go to get care for medical.
Yeah.
Now, one of the things that you young people can look at is if you really want to know what you want to do, is really start there. Is as a CNA. Even if you're in high school, that's about the best thing you can do is start as a CNA. Because this will let you get started small. This will give you direction if you want to work with patients or not. I started out as a CNA. I gave different options. If I wanted to work in the healthcare industry, or if I wanted to work in the administration field. Now, when I decided to do patient care, they gave me the option. Do you want to work in a nursing home or do you want to work in a hospital? And I thought, how can I determine that? If you want to work in a nursing home, you know, it's mentally, emotionally, you have to be built for that.
Right.
And the reason why I say that is because a lot of our elders, a lot of people that are in distress physically are not in the mood, you know, for little hyper things. They want someone there to support them. They want someone there to lift their leg when their leg can't be lifted.
Right. Yeah, thank you so much.
But
Yeah, well, actually,
in the
yeah, well,
administrative part,
yeah. Well,
that's the same thing.
yeah, you're really on the right path, because we're gonna talk about how we can kind of take those bigger picture dreams and break them up into smaller tangible steps. So you're ahead of us, right? Thank you so much for sharing.
Yes.
Appreciate it. All right, so along those lines of kind of taking this big picture, right, and creating those steps, we're gonna break it up into three kind of components. We'll talk about vision, your aspiration, and then goals, right? So your vision is your what? So again, you can go ahead and draw, you can write words, you can write a poem, right? But you want to utilize your journal that you have and think about your, right? So a vision is a clear picture of a desired future state, like the mental image of where you want to be, right? So you just think about, again, the big picture, where you want to be, right? You have that vision. An example is my vision is to become a compassionate, skilled healthcare provider who improves lives by delivering exceptional healthcare and advancing healthcare, right? Not going to take too much time again right now, but you can take this journal with you and if you want to think about that in the future, or think about that later, but we'll go ahead and move forward and talk about aspiration. So your aspiration is the why, right? Your vision is the what. Your aspiration is the why, right? Why do you see yourself in that space, right? Why do you see yourself as a surgeon? So an aspiration is a strong desire or ambition to achieve something, often with the focus on the personal meaning and motivation behind wanting to reach that goal. So dreams can be really helpful in the sense that they provide us a sense of purpose, right? They provide us some direction and motivation to continue on this really long, sometimes health journey, right? Just to kind of remind ourselves that those dreams and those aspirations can really help motivate us, be that internal motivation to get us to where we want to be. So an example is,
Sorry.
that's okay. My aspiration is to dedicate myself to lifelong learning and personal growth while committing to the health and well-being of individuals. Again, these are just examples. Your aspirations are right, your vision is your own. Any questions or so far? What else need one? So, while you're thinking about your vision and aspirations, we'll go ahead and think about the how, right? So you have your what, you have your why. Now let's think about your how. Has anyone heard of the term SMART goal? Yeah, yeah, awesome. So SMART stands for specific, measurable, achievable, relevant, and timely. Right, for those of you who said yes, you have heard of these SMART goals, can you give us an example of a SMART goal? Like what is something, or what does that mean, right? Yeah.
Something that has a realistic goal that you can actually set steps to achieving and a realistic timeline of achieving.
Yes, absolutely. Yeah, thank you. So maybe your big goal is to say, oh, I want to get into the healthcare field, right? A SMART goal takes that and breaks it down into tangible steps, right? So if you wanted to be a CNA, right, you can say, my goal is to apply for the CNA program within the next 3 months and earn my CNA certificate in 6 months, right? That's a tangible, like, you have a timeline, it's achievable, it's relevant to your values and your vision, right? So again, it's specific, it's measurable, you can measure the success of that and the success of those steps. It's achievable, you have resources, you have the knowledge, right? You have the programs that you can kind of continue on in there, and it's relevant and it's timely, right? You have that set timeline. Any questions or anything to add on that? Okay, so that was part 1 of our session. I'm gonna go ahead and hand it over to Linda and she'll take over part 2.
Yeah. Doesn't respond to them. Oh, there we go. Okay, so I just want to give some context for where my point of view comes from. So I worked as an academic advisor for health program students for about 17 years. And I just transitioned into workforce side of things and more in the administrative function of it. But I have a lot of experience in working with students, everyone who's gone through a CNA EMT class, through those preparing for medical school and everything in between. So I have a lot of experience in working with thousands of students over many, many years about like that pathway. And so I have a few suggestions, reminders for you. The first is that you don't have to have everything figured out. I think one of the things that we see with students who are coming in, whether you're a more traditional student who's a first-time freshman coming in, or you're a non-traditional student, is you see this, like I was telling Janelle this, you see this gigantic mountain in front of you and not sure how to get there. And there's usually one of 2 routes, right? You either retreat, right? You run away from it and say, nuh-uh, I'm not going that direction, or you're paralyzed with fear, right? Because you don't know how to take that first step. And so I say this because whatever project we're doing, you know, at work or at school, the whole point of this is just to say, you don't have to have everything figured out today. You just have to know what your first step is, right? So one step might be, and I met with a lot of different people from a lot of different backgrounds, your step could be to attend the PreMed Summit and find out more information about your next step. that's a tangible step that you can say, I don't have to have everything figured out today, but I just know that I'm showing up on a Saturday. And I'm spending some time with people who know more than I do about the process, right? So that's a very tangible step. And again, we'll be here next year. So if you come back next year and you're like, I don't know what I'm doing again, we're going to be here again next year where you'll have the opportunity to learn, new things or talk to new people. The second is that this is the process is an ongoing path, and success may not, as you define it, might not be immediate. I have students that have applied to med school 3 times, right? They're good students with good MCAT scores. I've had students, who applied to pharmacy school who on paper think that they've done everything right, right? And then you apply and you're like, okay, I didn't get my outcome, right? And sometimes your path is going to look a little bit differently than everyone else. And sometimes those obstacles are put in front of you so that you learn something from that process, right? Because sometimes the delayed gratification, we're in an instant gratification kind of culture, right? Where we want things instantly, we want information instantly. And we're going to talk a little bit about AI in a second. But we talk about these things because students see this pathway of, I'm whatever age you are right now, and I want that end goal now. It doesn't happen that way. And sometimes it takes you a little bit longer than you think that it's going to take. So just kind of understand that that is a process and that success as you define it might look a little bit differently. But also there's no single method to you reaching your goal. Every single student that I have worked with has had a different path, right? You might have the same major as someone. You might have the same high school background as someone. There might be very similar things that you might have to another person, but your path is going to be completely different because you're a unique person. And that's something that I think is really hard when you're sitting in classes with other people, or you're seeing other people that seem to be moving a little bit quicker than you are. And you're like, wait, like I did everything that they're doing and they're moving a little bit faster than me. And that's okay, right? Because your path is your own. The other thing that I kind of put into reference, and not to scare you all, but we're working a lot longer. So back in the day, my dad always is like, you should get a government job, which probably isn't a good thing right now, but you should get a government job and you should work for 20 years and you should retire, right? We're not doing that anymore. We are working for 20 years in one career, right? I'm looking at Amy because she probably knows this. You work in clinical space, right? You go into higher ed, right? A lot of faculty I know have done this where they work in the clinical space. They go into higher ed or into education, right? Into administration, and then they reinvent themselves again. So there's a lot of things that you want to think about of what your career is going to look like. And it might not exactly look like what you think it was. Because I actually thought I was going to retire from advising, and then I jumped ship halfway through. So but also stay consistent. And this is also something we know, we've learned this, right? Whether it's working out or on your eating plan or anything else, that the way that you're going to make your dreams become reality is being consistent. And again, continuing to take those steps, because it's really easy to retreat. It's really easy to stand still, because those are spaces that can be comfortable for you because you're like, well, I'm chill, I'm good. And then you realize years go by and you're like, wow, I didn't really get as far as I wanted. But every step that you're taking is helping you to achieve that goal. So I kind of said this already, but your path is your own. What works for you is not necessarily going to work from another person. And this is also my advice also for family members that are in the room. It's really easy to say, well, this person, you have a family member that did a certain pathway. And then they say, well, so-and-so did it this way, you should do it the same. And I think that's really hard it puts a lot of pressure on you as a person to follow that pathway. The day that I told my dad that I didn't want to go to medical school was like doomsday, right? Because he's like, what? You did all this work to go to med school. You did the right thing. You did the biology degree. You did your summer programs. You did undergraduate research. You took your MCAT. Why aren't you going to med school? And I said, because I don't want to. And it took him a long time to get over that. It took me less time to get over it because I found a career that I loved, right? And I'm excited about it. And I'm excited to be here today. So I think those are things that you have to also be prepared to reframe what failure looks like to you, because we don't normalize failure. We see failure and say it's forever gone, right? Like we're like, oh, we failed a class. I remember I had a conversation, I think he's the dean of the College of Pharmacy at ISU, Tom Wadsworth, and a student asked him, if I fail organic chemistry, does that mean I won't be a good pharmacist? And he said, no, because pharmacy is much more than a single class. What is more telling about a student is if they come back and they're successful in that class, because that's telling me that they're resilient, that they know they've learned from their lessons, right? They've learned from things and they can come back and be more resilient and more apt, you know, in our field. And so those are the things you want to learn about it. Now it's hard, by the way. It's hard to not be critical on yourself. It's not hard to be like, I'm a failure, but you also want to surround yourself with people that are going to champion you even when times get really tough. But also that goes into to manage how you celebrate your successes and to say, I did this and I did it well, and to celebrate that, even if it's not exactly where you want it to be, to say, I accomplished this and I'm moving forward. So, did it? Okay. Okay, so I'm going to tell you that this is one of the things that I tell students a lot is the pivot plan. Because life is going to throw you a million curveballs, right? It's gonna, when you create offshoots, if you create opportunities for yourself that allow you to explore what you're doing and enhance what you're doing. And Janelle actually gave a really good example for those that play basketball, right? If you have the ball and you're standing still and you don't look around, anything around you, you might not have very many options, right? You might have defenders coming your way. You might not see someone over here that you could pass the ball to, right? But if you're pivoting and you can look as far around you as possible, you're going to see a lot more opportunities that are available to you. And so my example would be, don't just go this linear path in the sense of, I'm going to get, and I'm going to make fun of biology degrees. I also have a philosophy degree, which I'm sure for people who are in industry know that those are not very marketable out in the job market. But my point is, if you just go that direction, and I had no other job marketability skills, right? It wasn't involved in student clubs, or I didn't have an on-campus job. If I left my degree and that's it, and I didn't do anything else, my job prospects would have not been here. I still would have had to go to grad school or something. My suggestion often when students are pursuing their education is to look at certifications, right? Look at opportunities to enhance what they're doing and be job marketable. So even if you decide to delay your application to graduate school, that you have options. Because a degree alone might get you some jobs, but it might not get you the job that you really want, right? To build the skills that you feel that you're not as strong in as you're preparing for a career in healthcare, right? And so that's actually, we talk about CNA, we talk about ETT or EMT or other skilled training, right? Where you can combine these skills and then, you know, job markets might say, okay, we might be able to take a chance on you and train you within that. There's other also departments, and I've talked a lot with Fairbanks Memorial Hospital. They're like, hey, we just need a high school diploma. We'll train you to do the rest. So a lot of times it's looking at the opportunities in your community to get that additional training and support, either through apprenticeship programs or other things. And it's the things that we're not seeing as traditional, right? Because the students that I also see are the students that have those traditional biology degrees. They come back and say, I don't know if I want to go to med school. I don't know if I want to go to pharmacy school, but what do? I want to be in healthcare. There's still a space for you, but it also just may take a little bit of effort to get to that point. And so my suggestion is that you don't close yourself off to opportunities. A lot of students want the clinical opportunities. I remember when I was shadowing at Providence, everyone wanted to go to the NICU, right? And they're like, no room for you. I was like, okay. So I actually was assigned to the cancer registry, and I was data entry, right? So data entry, and I was like, this is so boring. But what I learned is a lot of information about how the infrastructure of a hospital worked, right? So I got to understand how the operational side of that. it's super appealing to only want to see clinical, right? To only want to see certain things because that's cool and that's interesting to you. But it isn't also telling you how the healthcare system works. And more schools want to know, are you well-rounded enough to know how healthcare works? Not just if you can walk into a patient interaction and know how to work in that environment. So I would say, don't close yourself to the opportunities that might exist, that might be not so jazzy on the outside, but really provide you a fruitful learning opportunity and meaningful opportunity. So certifications, job shadowing is really helpful. I did job shadowing for a couple of different things, but I thought that I wanted to be a pathologist, and then I shadowed a pathologist and it was like, nope, not what I wanted to do. And part of that was I didn't really want to do autopsies. Didn't know that until I actually shadowed someone. And I also didn't want to look in a microscope all day, right? So those opportunities that you have, and some of these require special permissions, right? And some of them require just going through, like Providence has a great shadowing program that allows you to kind of go in and see different things. So I would encourage you to take those opportunities. Not all these opportunities are going to be presented to you. You're going to have to actively go seek out and find them for yourself as well. Now you can always ask for help, right? Say, where can I go find this information? But some of it's going to take a little effort to get there. And I think that's it. So yeah, so my name of the game is pivot. Make yourself as marketable as possible. Make sure that you have as many resources as available. Think about alternative career pathways. The other thing we've been talking to students about is that the careers today may look very, very different 20 years from now, right? So what you think about as like I'm entering in, think about what healthcare might look like in 20 years. Because I think of people who've been in healthcare, think about what 20 years ago healthcare looked like. They'll think about how different it was. So just think about how your career trajectory kind of reflects that. I don't know where we are on time. We're pretty good. We have 5 minutes left. Okay, so I think we have a little bit of time, but are there questions? I know I kind of give you sort of like, sometimes it's like the dumb moments where like, yeah, doesn't everyone know this? But I think sometimes we have to normalize these conversations to say it's okay to not know what to do.
I don't know if you mentioned this earlier, but it mentioned something about AI or something.
Yeah, I'm gonna show you something. So we were talking about how we would incorporate this, and we were only going to incorporate it if we have time. So back when I was in school, we had to have books that we actually had to go look for things. You guys have the great opportunity to potentially use AI. And so when I was preparing for med school, which I didn't wind up going, obviously, we had papers and we had documents and we had all these things that we had to go search for. We had people we had to talk to, which I still encourage you to do, by the way. But now you have AI, and Janelle and I have been playing with this a little bit, and I'm like, where was AI when I was in school? Because this thing just spit out some amazing things. So I should have preloaded this. So sorry for my. I'm gonna open this up really quick. I don't like one of the sponsored one. Okay. So I am going to we're gonna do a little bit of Mad Lib really quick, okay? So, and actually I need to stop share and share this. Share this again. There we go. Okay, so when all else fails and you're hitting a roadblock of what do I do? What's my plan? What's my step-by-step process? AI exists. So I want you guys to, we're going to talk about medical school because this is just sponsored by WWAMI, and so we should do that, right? I want you guys, what's a year in school? The undergrad, high school? High school freshman. Freshman, okay, high school freshman. And I am interested and majoring in not biology or chemistry. Anything else? Music, awesome. I would like to apply with 3 med schools. UW. Second. John Hopkins. What was that? Harvard? Let's do it. Harvard. You can add more detail. The more detail you provide, the more detail that's going to give back, okay? It's a great thing. You're already thinking of applying to med school. Applying to med school, especially given your interest in studying music. Okay, so here's the thing. This thing spits out more or less pretty good feedback on what you should be doing your freshman year, your sophomore year, your junior year. It keeps going, right? All the way through. I was so impressed with this thing. I was like, wow. And I did it for myself, right? If I wanted to go back to med school, I gave it all my information. It gave me a step-by-step process. Now, this is not perfect. AI is only based on the feedback that it has on the internet and what you're giving it. But if you're stuck and you're like, I don't even know what questions to ask, like I'm going to go talk to an advisor, but I don't even know what to ask him, to ask them, like, this is a good place to start, like saying, hey, ChatGPT gave you this recommendation. Is like that, is that legit? Like, is that valid? And they can tell you whether it is or not. I was talking to advisors and like, is this going to replace us? And I'm like, well, maybe, I don't know. But I was super impressed with how like actually accurate it could be for a lot of students. And so just keep in mind, like to use those resources as much as you can. Volunteer and shadow. I don't know what this music portfolio is about because I haven't done a music major before. So, but perfect your applications, right? Well, it's telling you to apply to music programs because you're a freshman in high school. And then it gets in here, preparing for medical school, tells you the steps, keys for success, seek mentorship, balance is crucial, right? You probably have heard some of these things as we're talking to people today. So my point is when all else fails, you have a great resource in AI that's going to more or less give you some really good direction and at least give you a framework for conversation, conversing with others about questions to ask and things to move forward. And honestly, I just started using AI this year because I've been really like suspect of it, but it's been kind of helpful in reframing that. And I know that it's going to be something we're going to be using in the future. So I wanted to see how it was going to work. So we're at time. I wanted to see if there's any questions and we're going to be around. And there's a question in the chat and I'll actually address you guys in a second in the chat. But we're happy to answer questions, but definitely use this as an opportunity to really network and communicate with people. It's a great event to attend every year and hope you get something out of it. So we're here though. We're going to let you guys go and have a break. I know it's been a long day, but thank you so much for being here.
Okay. So you're unmuted. You're welcome to start whenever you want.
I think we're just gonna do brief introductions. So hi, my name is Abby. I'm a first year medical student at the University of Washington School of Medicine. I was born and raised in Wasilla, Alaska. I went to my undergrad at UAA. I majored in natural sciences and I minored in psychology. And then I worked in the ER as a scribe. I also was a pharmacy tech. And then I donated my bone marrow to my brother at the NIH, and I've kind of volunteered in multiple places throughout Anchorage and the Valley.
I'm Michaela. I'm also a first year med student at University of Washington. And I grew up and was born and raised in Anchorage. And I did my undergrad at Stanford. And I majored in human biology with the focus on abdominal psychology. And then I worked in neurobiology research at Stanford.
I'm Stacey. I'm also a first year med student, WWAMI. I grew up in Anchorage, went to South High School, did my undergrad in Fairbanks, did a double degree in biology and psych. And then after I graduated, I came back to Anchorage and got my master's of public health at UAA. Then I worked at the ER. I did a bunch of kind of like odd job, like small jobs before med school started.
Hi guys, I'm Alyssa. I'm originally from Fairbanks. I got my degree from UAA, but it was kind of weird because I did the exchange route. So I got to go to Hawaii for a little bit, and then I spent most of my undergrad actually in Montana at Montana State. Worked a lot of jobs in undergrad for medicine. I did scribing in the ER up here at Providence. I was a tech in the ER. In Bozeman, I did a labor job with the state on the Hall Road, Dalton Highway, serving, worked in the ice cream shop, like pretty random. My degree was in natural sciences with a minor in psych, and I took 2 gap years.
So I think we're kind of just gonna open it up to questions, so whatever you guys wanna ask.
So 2 of you worked as medical scribes, yes?
Yeah.
It was immediately after getting your bachelor's degree.
So for me, actually, the moment I turned 18, I started scribing in the ER, and I scribed in the ER for 5 years at Alaska Regional up here, and I loved it. The doctors there are amazing. And you learn so much, and it really prepares you for medical school. It teaches you how to write an HPI, which is a history of present illness. It kind of shows you what a physical exam looks like. And it was really beneficial for my education, I think. So, but I was there for 5 years, and like I started right after I graduated high school.
What do you need any background?
No, yeah, to scribe, you don't need any background, which is really nice. And I think they're actually hiring at Alaska Regional. They always need scribes. There's high turnover, so.
What all did that entail you doing?
One more time?
What all did that entail you doing?
Yeah, so essentially you work one-on-one with an ER doctor and you do their notes for them. So you follow them, you see the patients with them, and you do their documentation in an electronic health record. So you get to watch procedures if you want. So laceration repairs, intubations, incision and drainages. It's essentially you working one-on-one with an ER doctor throughout their whole entire shift, documenting on the patients that they see. And then I'll let Sadie kind of say.
Yeah, so it's kind of cool that both Abby and I here because I was the opposite. So I did a few gap years, and while I was doing my master's, my employment was like not medical, like not medicine related at all. I worked as a ski coach and worked at Black Mountain hiking for a bit. Just was messing around in the backcountry a lot. And then when I was 100% ready to start applying for med school, I talked to Dr. Uffenbeck, actually the pre-med advisor here, and she reviewed my AMCAS and was like the weakest part of your application is that you don't have any clinical experience. And so I was like, okay, what would be a good thing to do? And she said, well, scribing is probably one of the most common things that, you know, pre-meds do, and you get a really good experience. Like I said, working with a bunch of different doctors and seeing a bunch of different type of medicine. So I just basically went online, Googled like scribing jobs in Anchorage and do Scribe America. Just applied, and they got back here pretty quickly, did the onboarding process, and then just started scribing. And at that time I was like, oh, this is going to be an experience for me to like kind of bolster my resume. But like Abby said, it was really awesome. I think that it really made my application stronger, but also made like my preparation for med school like way stronger. So
And I also scribed my sophomore year of college, That was during COVID time though, so I got cut off when they kind of stopped unessential workers. But I think, yeah, like they were saying, it gives you great opportunities to connect with doctors and like really get a good idea of what the job's gonna look like before you commit to med school. And then I got to do the tech thing. I started doing that during my gap years, which was really cool because I had seen what the doctors do, followed them around and wrote their notes, and then getting to do the tech thing, that's like the hands-on part. Like I did it in Montana, which is a little more hands-on than Alaska lets you get, but like CPR, reading EKGs or splinting, reading IVs. So I think any clinical experience you get before you apply would be good. And I don't know if there's like really a preference. I think it's just whether you'd want to see what a doctor's note looks like more, or if you want hands-on skills more.
Yeah, so I think all three of us described at emergency departments, right? You were at prom, Abby and I were at regional. And ED is super nice because you get to see a bunch of different like parts of medicine, different pathologies. But that being said, like let's mention, you can scribe at all kinds of different clinics. So just based on what you want, like if you kind of already know like what type of specialty you might want to go into, it might be worth scribing at like, you know, a renal clinic or a cardiovascular clinic or something. But if you're not quite sure, you can super nice for that.
So how flexible do you think that is with doing other like extracurricular things like college?
Yeah, regional specifically, like I was still in my undergrad and you can work nights, you can work days, they're 8-hour shifts, which is really nice. So you can do a swing shift after class. You can do 1 day a week normally. The nice thing about scribing is that they always need coverage for the doctors and they kind of work with your schedule. So it is really flexible. Like I said, I was able to do research. I was able to still go to undergrad. I also was volunteering at the same time. So they kind of work with your schedule. And if you wanted to do nights, you can. If you wanted to do days or swing shifts, it's really nice in the ER specifically because they have full-time coverage, that's 24 hours. So it's definitely doable. Yeah.
Yeah, it definitely depends on like how much you value your sleep cycle. So when I started, the coverage for the daytime shifts were pretty full. So I did my first 2 months like on nights. And then after that, I was like, you know, I think I just want to stick on nights. When I got into this rhythm where I do my shift from 10 p.m. to like 6 a.m., get home at like 7 a.m. and then I would just sleep until 3 p.m. And then at that point, all my buddies were like getting off work and stuff. I just go hang out with them before work and then get to work. So it's super nice. Like, yeah, so it's pretty flexible.
Yeah, I would say I did it, and I remembered when I did it during school, I did not like it. Working the night shift when I was off was a little better. And then if some of you are paying for your school, I think it is important to note, like Scribe America does not pay very nicely. It's definitely to like work your way up the ladder. They know that they're getting the pre-meds and they know you guys are putting in the hours so you can apply to med school. I think if you were to go get your EMT certification, or if you have it, that kind of opens doors to those tech positions, and then you can get paid that overtime, which I really like. And there's more PRN positions that open up, at least for me. Like I was lucky enough to find a job that required like 3 shifts a month to do, so super flexible. And then you could like wait until they're like, we have a need right now in the ER, can you come in? And then you're getting a little more to pay for your stuff, because I paid for all of my expenses on my gap years.
You said the schedule is like super flexible, like I could only work 1 day a week. It's like
Yeah.
summer, I have like a Monday through Friday job from like 8 to 6, so I wouldn't be able to do too much between that.
When I worked there, we had a lot of coverage, so I still know people to this day that don't really work a lot, but if you wanted to work more, you could. I know at regional specifically, like I know their boss, and they're always hiring, so they need help. And just communicating with their boss right now, his name's Morgan, just communicating with her your schedule. I'm sure she'll be more than happy to work with you. I think they would prefer people who can work, you know, obviously more than 1 day a week, but if that's all you can do, just be clear when you interview there. So yeah.
I know some of you mentioned that some of you took gap years and some of you didn't. For people who did take gap years, like, did you find it beneficial? And then for some of you who didn't, do you wish you did, or you like, is med school so good with like that you're fine that you didn't take gap years?
I'm like really adamant. I think gap years are so important, and I think most of our class really agrees on that. Like once you get in med school, it's a lot of time dedicated to studying, and your schedule doesn't really become your own. And I think, yeah, and like even in undergrad, you're focused so much on school, it's not a lot of time to like really get to know yourself and explore your interests and set yourself up for success and like developing hobbies and friendships that are gonna get you through med school. I would not be, like, I remember being an undergrad and being scared to take those gap years, but like, I'm so glad I did, like. And I don't know, anyone in our class I've talked to is like, I'm really glad that I took gap years.
Yeah, I think there's only like a handful of people in our cohort that are straight out of undergrad.
Like one person.
Yeah, maybe like one.
Yeah, and they're doing great.
And that's not to say like you shouldn't like start thinking about it and like start thinking about the application process in undergrad, but for a lot of us, you know, like during undergrad, we took that time to do like extracurricular stuff too, and it just gets really hard when you're trying to do the AMCAS and study for the MCAT and everything, and I think there's a balance though, because I took like 3 gap years, so then when I was studying for the MCAT again, it was like, you know, I was like, oh, what is this? Like, I don't even remember studying any of this, so it's good to like think about that, and if you are really set on med school and you decide to take a few gap years, just to make sure you're also preparing yourself, so don't just like take the gap years to do nothing like medicine related.
I think like for me, I was completely dedicated to starting med school immediately after I graduated. So I did like my MCAT, like my junior year of undergrad, and I was like fully gearing up to just apply. And then I realized it was just like way too much. And I wanted to have fun. Like my senior year, I was on the equestrian team. And so I like went to nationals my senior year, and I got to just like spend a lot of time like doing the things I loved. I worked in my lab, my last 2 years of undergrad, and then about a year after. And so I got to spend a lot of time just in the lab, and I loved that. And so that was really fun. And just taking that time to just be a working person, and also like working on the applications and finishing up secondaries, doing interviews. I feel like personally it would have been really hard for me to do those things if I was still in undergrad, because like even prepping for the MCAT and stuff, like during while you're taking classes, personally a lot, so.
And for me, I agree with everything that they said. Once you start med school, there's no stopping, right? We go through the summer and then you start residency where you're on call and you don't get any days off. So the next 8 years of your life will be dedicated to medicine, and having that year or two, just, you know, it's really beneficial to spend time with your family or get out. I'm super outdoorsy, and I haven't got to be outdoorsy because of the winter we had, and we start medical school in July, so I really didn't get to hike and fish as much as I wanted to. So like really spending time with your friends and family before you start, I think was so beneficial for me and overall how I'm doing in med school. Like I'm not burnt out. I think going straight into undergrad, right into med school, right into residency can lead to burnout, and it's really just nice to have those gap years to one, mature as an individual and build your application. You know, you want to be the best that you can be when you're applying to med school, and those gap years kind of give you time to, you know, really make your application as a whole better.
Thank you guys.
Yeah.
What surprised you guys most about med school that you weren't expecting?
One positive was I wasn't expecting how close our cohort is. I think it's a blessing going to medical school in Alaska and having this small cohort. There's 26 of us, 27 now, I think, and all of us are close. I know that if I asked my classmates, like if I needed help, I know all of them would drop what they were doing and help me. And I was shocked that you have that support from your classmates. On the other end of it, I would say I didn't know how much of a time commitment it would be. I knew everyone tells you medical school is going to be hard, but I didn't know how much time you actually spend studying. I was kind of taken aback by how much I study outside of class, right? Attendance is mandatory in Alaska, so you have to go to class 8 to 12 normally. And then you're putting in hours on the other end studying, you know, we have Monday and Friday exams. So your weekends are kind of taken up by studying if that's the way you do it. And that's the way I do it because I kind of don't study during the week. So I rely on my weekend. So yeah. I was surprised that our cohort is so close, and then I was also surprised about how much studying I do.
Yeah, I think one thing too is like, yeah, our cohort's super close, but also I was surprised by like how amazing, like our professors are just so great and like so supportive, and they're really like everyone's there to make sure you get through. Like once you're in for like the long haul. So they're there to like help you with that, which I think is amazing.
Yeah, not to like, well, yeah, it is a WWAMI plug, but like one thing I was expecting was how awesome the faculty here are at WWAMI. There's like 2 counselors that are available for you at any time. All the faculty are pretty much like super quick to email you back if you have any questions. I think a great example is we just started our CBS block, which is notoriously one of the hardest blocks. And we had an exam on Monday, and we had some case studies to prep. And so our professor just emailed all of us the answers for our case studies, because he was like, I know you have an exam prep course that listens to help you with your case studies, and so like, just those kinds of small things are super nice, and, you know, obviously I didn't go to any other med schools, but like, I think it's pretty unique to WWAMI, and I think that's just inherent of like the WWAMI program, where you have the 5 different regions and the 6 sites, and there's so much like collaboration between the sites and stuff. I think that's just, yeah, it's really great about WWAMI that we have so many faculty from all different sites who are like contributing to our education and to our well-being, so.
Yeah, and she made us egg rolls.
Yeah.
Yeah, good. Yeah, I get support, that surprised me. I thought that I would make close connections, but I didn't realize it would be with the whole, like, our whole class really is pretty close. Surprise, I thought I would get into a rhythm better. Every block feels like I'm restarting medical school. I don't know if I'm alone in that, but it definitely feels like I fall and then I have to get up and then I kind of catch my grounding at the end of the block and start all over. So, but I guess it's cool, like seeing the process happening over again. I'm like, okay, I can do it. Next one.
Throughout your educational journey, how do you guys respond to like not feeling smart enough or not feeling capable enough to just like do the coursework, like even in your undergrad and in medical school now?
Yeah, I think my undergrad was a little bit different because everything went online because of COVID, so I didn't really feel that. But I will say, starting medical school, my cohort is absolutely incredible. You look at everything that they've done and you look at how they're doing on exams, and I think it's normal to compare yourself to others. We call it imposter syndrome. And honestly, for me, that's never gone away. Like I always feel it's always in the back of my mind. I'm like, oh, I should be studying. You know, I bet people in my class are studying, but it's nice having that support within your class. Like I have a few people who I can go to and talk about that. I have 2 really, really good friends in class that we kind of, you know, when you're feeling that, you can go and communicate with them and they offer you support, which is really nice. And then the nice thing about WWAMI, like Sadie said, you have counselors that are available to you for free. You don't have to pay for them, that you can go to. And any faculty, I'm sure, would be able to help you out. That's the nice thing about WWAMI, right? There's only 30 of us. You can build that one-on-one relationships with your professors. And it's really nice having that support from your classmates and from faculty. That way, if you didn't want to talk to your classmates about it, because if you didn't want, you know, the stigma, you can go to faculty and it would be confidential, which is really nice. And then I'm super close with my family, so that's also people I go to. I'll call my mom up and I'll be like, Mom, I didn't do as well on this exam and the class average was this, and I got below the class average. And she's like, it's just one exam, right? You're still gonna be a great doc. And then your classmates are also there for you to pull you up at times when you're not feeling your best, which is really nice. I'm really grateful to these people sitting in front of me. I could not do it without my classmates. Yeah.
I think another good thing to keep in mind is that if you feel like, oh, I don't know enough material, I'm not prepared enough, is that you're not the only one who feels like that. And unfortunately, like once you start med school, you're gonna feel like that a lot. But going through that, we also call it trauma bonding. I think it's like being there like with your classmates, and like everybody has their different strengths. So like not being scared to like go up to one of your cohort members, like, hey, like, you know, so Dr. So-and-so talked about this, I'm not quite understanding it. Do you think you can help me with that? And everybody comes from different backgrounds, like people scribed in different places, did, you know, were MAs different places were, you know, rad techs in different places. So everybody kind of has, like, I think it's interesting that we have so much diversity as far as like what people did before school. So you can tell when somebody gets super excited about like something that they worked in kind of beforehand. And I think that's really cool. It brings a lot of like diversity to our class, a lot of like knowledge bases, but yeah, just knowing that like, oh, I feel like I don't understand something, you're not alone. Like go to somebody, go to professors, your friends, whoever it might be. And also just like not like getting into that mindset of like despair. So like again, like when I took my MCAT, it was like 3 years after undergrad, and leading up to that, I think I did like 6 months of dedicated MCAT studying, and before I started studying at all, I took a diagnostic MCAT to see if I even needed to study for it. Like that was a little bit like kind of cocky, but like I did the diagnostic, and it was super helpful. It was terrible, like 486 or something. And I was like, oh, I guess I'm not going to med school. But I like did a Kaplan course, dedicated like 6 months to it, and like that brought up my score right away. And I was like, okay, so I do have the ability to like dedicate myself to this, to study something. That was also a really good metric for me about like whether I would be a good fit for med school, because you know, med school is like, it becomes your life, right? Like it's very, very difficult to have a job. They basically tell you not to have a job during med school, and you are expected to, you know, it's like 8 hours a day, they lecture plus studying. So being able to do that for the MCAT, like, you know, taking time off work, studying, you know, 7, 8 hours a day, and then like seeing like how that reflected in my score was like super positive. So know that like once you're in med school and you're dedicating that amount of time to something that you don't think you understand, you will understand it, but you know.
I guess like at my undergrad institution, like everyone always goes like notorious. Everyone talks about like floating duck syndrome, which is like everyone, like you see everyone else, like the duck, like the top of the duck. And so it looks like everyone's like floating along the surface, like doing like so great, not having to do much work. But underneath, they're like paddling like crazy. And so I think that's like a really good way to think about it is like, yeah, you might think everyone's like, you don't fit in, that you're the only one that's struggling and like having to put in so much work, but you're not. You're like not seeing underneath the water. And at least for me, like in undergrad, like the Native Health or the Native Student Services was a really great resource for that. Just like talking with my community and just getting help in just feeling like I belong. So
I was really lucky because my mom is a physician, but my mom was a nurse for 8 years before, and she's first generation American. She grew up speaking Spanish, and she was like, I never thought that I would go to medical school. And she was always telling me like, if I can do it, you can do it. And I think that's like a huge stat is, like, I think 60 to 80% of accepted med students come from households that like can support you financially in doing that. And so, I think if you don't have someone that came before you that has gone through this route, it's gonna be more difficult for you, but there are resources out there, like studying for the MCAT alone. I think prep courses are like $2,000 or more. And I think there are programs that can help you. Also maybe like finding a mentor in the community, because having a physician to lean on that had to do it for the first time, I think could be really helpful, and finding advice from that. But don't be scared if this is your first time doing it and you don't have like a role model to look to. You definitely can do it. You don't have to be the smartest person to go to med school. You just have to work really hard to get there.
See a notification in the Zoom chat. I don't see that's a question. Yeah, keep asking questions.
So I know with Hillary, we're gonna give the options at the end, you know, you spend your time working in Alaska and it's paid for. What about the rest of the expenses, like just living, you know? And I know most of us are working, if you're coming out of undergraduate, you probably have room for many seats anyways, you know, how's that?
It's expensive. I think the, I thought that WWAMI would be paid for by the state, but they just pay for the out-of-state portion. So we're still quoted at 90,000 a year. And at that point, we're just taking out loans, and a lot of people are in debt, and you have to kind of like make a decision on if on the back end, it's gonna be worth it for you. And talking to physicians in our community, it seems like it hopefully will be like job stability, but yeah, you are definitely getting put in the hole. I think like staying in Alaska for undergrad helps a little bit. WWAMI does have some financial resources, but I'm honestly like, it's still kind of hard taking out those loans.
Like that being said, though, the opportunity to go to med school in Alaska as Alaska is really cool, and it is much less expensive than if you went somewhere out of state. So it's obviously a really important thing. I think finances are unfortunately something that everybody has to deal with, but I think for me, I'm trying to keep that at the back of my mind. And as far as the med school itself, and during this time, even though, you know, it sucks to see $29,000 a semester like leave my account, like it's like I'm doing this because I want to do this. Is what I want to do for the rest of my life, and this is what I've wanted to do for so long, and so it's all going to be worth it. And yeah, I think it's, while it is important for me, I'm trying to keep it as like one of the things I'm not worrying about or not like thinking about like during med school. Yeah.
I remember like during one of my interviews, like it was all virtual and it was like for a different school, but somebody asked like the current med students, they're like, so like is everyone just like working like on the side? And I think this was like a very eye-opening experience for me, because the person was like, no, like absolutely not. Like, and they're like, okay, how do you pay to live? Like, how are you actually like sustaining yourself? And they're like, loans, like you just have to do it. Like that, I mean, it just makes such a difference, and yeah, and it's worth it.
It's just part of it, right? I knew, like, I was in your guys' seat, I was at the PreMed Summit when I was, you know, back then during my undergraduate degree, and I knew I wanted to be a doctor. And being a doctor comes with taking out loans. That's part of it. The nice thing is that normally you're compensated well once you're done with residency, and if you're smart and you don't go out and buy a boat and you don't go out and buy a Porsche, right? If you're really like
if you prioritize paying off your loans, it's not that big of a deal. Like, you will pay them off as long as you put in the work and as long as you don't make poor financial decisions on the out of it. So for me, yeah, it's stressful seeing that money come out of your bank account, and yeah, it's stressful signing your name on that dotted line, but I want to be a doctor. And anywhere you go, you're gonna have loans. Maybe they may be more expensive, if you go out of state, but it's still gonna be a decent amount of money. And just being smart about it once you graduate residency, I think is the best way to go about it. Just know that it's part of it, and all of us feel it. Every time the money comes out of our bank account, every single semester, you're nauseated. It's like, oh my gosh, here we go again. But I know myself, and I know that once I'm an off, I'll pay it off, you know, it's part of it, it's another bill, right? You just start paying it off when you're making money.
We've talked to a lot of the doctors that are training us, and I have not heard one person say it's a bad decision that they've made to take out loans. Like, everybody seems very happy with their decision and like okay with it.
How did you guys decide what you wanted your undergraduate degree to be? And kind of a follow-up question with that is, what was your backup plan for if you decided not to go to med school?
I did not have a backup plan. My degree is natural sciences. You can't do much with it. I started in bio. I knew I kind of wanted to do pre-med. I switched to natural sciences because I did the exchange route and bounced around the country for my undergrad. And it was like super flexible. And I just thought, like, I think the application into medical school is pretty flexible. You can build it to how you want to be. You want to set yourself apart, check those boxes, but also set yourself apart. Do things that are interesting to you, that build you as a person, lead you to the path to medicine, like it's right for you. So I did natural sciences because I was like, okay, flexible. It gives me some time to do stuff outside of that. But yeah, don't be afraid to part from the biology degree. Like, biology will get you there, but like, do something that you like and like you can fill in the gaps in other areas.
Yeah, for sure. Like, UAM doesn't have pre-med like track, so that's why I did bio. Like Alyssa said, I certainly didn't feel like I had to do bio. That's why I also did psych, because I kind of wanted that background too. The only thing that I would say is, like, if you're serious about med school now, make sure you look at the schools and see what their prereqs are, so that you have those covered by the time you apply. Yeah, really do any degree. That's why we have like engineers, people who are like BAs, like all kinds of.
Yeah, my friend's a math major.
Yeah.
That's the nice thing about med school. You don't have to have a biology degree. You can have an arts degree. If you're passionate about it, yeah, go and do it. It'll make undergrad a lot easier. Like, for me, I love science, but getting a science degree, I was like, oh my gosh, I have to take like geology. I'm not really passionate about that. So if you're passionate about a specific undergraduate degree, take it. But like Cindy said, just look ahead, look at the med schools you want to apply to and see their undergraduate requirements. And I didn't have a backup plan. Like, I knew being a doctor was right for me. And I talked to pre-meds and they said, hey, take natural sciences route because you don't have to take Calc 2. And I was like, heck yeah, I don't want to take another math class. So the difference between getting a biology degree at UAA and a natural sciences degree was like the math. And so that's why I chose natural sciences. From talking to other pre-meds who were in WWAMI and who were applying, they told me, they were like, oh yeah, you don't have to take Calc. And I'm like, sign me up. That fits the box. I don't want to take Calc 2. And I was like, okay. And then I minored in psych just because it was on the MCAT, and you can minor in something with whatever degree, you'll get enough electives that you can minor in something, and so I just chose psych because it was on the MCAT. Yeah, I was lucky, like, our human biology program was like very strong in undergrad, and you could kind of like mold it to whatever you wanted. And so for mine was specifically the neurobiology of abnormal psychology, because I was really into psych, and that's why I did research in that and stuff. And so I guess, like, if I had to choose a backup, I probably wouldn't have, because I don't know, like, research is fun, but it's not like a lifelong thing for me. But I probably would have been something like that. And so I had set myself up for that, like, throughout undergrad. But yeah, I thought about getting a minor in psych, but then I had to take another like stats class, and I was like, I'm not doing stats again.
I'd say, like, all your extracurriculars, the jobs you're gonna work, the degree you're gonna get, like, you are building your story on like what led you to med school. And so it's very flexible. Just like think of what story are you telling to the admissions committee that like tells them that you're meant to be a doctor and you want to be there.
And that's it. We're out of time, but I'm gonna.
Okay, so we've always talked about studying. Have you figured out like what's an optimal amount of studying? Like how many hours would you say you have to do like every day?
Oh God.
Med
at school, we study by system, so your first 6 weeks are all your first 6 weeks are all your undergraduate sciences, and then you kind of go into like immunology and infection, and then we did our anatomy block, and now we're in cardio. Every block is different. I've spent, depending on your background, like Mick did research in psych, so I bet when we get to our mind brain behavior block, it'll be easier for her. It just depends on your study schedule and how you function. But it's different every block. So every 6 weeks it changes. Like I spend more or less time depending on the block we're in and my background. But it is a lot, and it's always a lot. I think.
Yeah, I think that's the important thing to preface is like Abby said, everybody does have a different way that they study, but expect to be studying a lot.
Yeah, you'll figure it out though.
Yeah.
Like different methods work.
We're you I figure out. So come in, you guys can come and find me.
Yeah, you guys. And if anyone wants my contact info, you can talk to me. I'll give you my email.
Yeah, and like, we're like, there's like a WWAMI table out there or something, if you didn't get a question answered, like, people ask WWAMI things, and I'm happy to. Yeah.
I didn't know what like the experience like.
My notes with everybody's name.
Of course.
That's what I'm gonna do.
Right hand and the cards.
Yeah, because it's not.
Yeah. So I'm the chair for health sciences.
Okay, folks, last session.
Sorry, I've been back to back, yeah. Hi, all right, welcome. So this is our last session. I am so happy that so many of you are still here. This is lovely. This was such a wonderful day, and we have a great panel for you here. And when we were trying to figure out what we were going to do for this final, sometimes we have keynote speakers. What we really wanted to emphasize is that there are a million ways to get to medical school. And there are a million things that you can do to prepare. And you should be thinking about what really resonates with you and sings to your heart. And thinking of yourself as a future physician, what you think you want to experience before you get there. And so we have these great programs here at UAA that have fantastic offerings. So we're going to talk a little bit about that. Dr. Wright here we brought specifically because she took a non-traditional path, right? So we thought it might be nice to hear from someone that has a little different, that everybody that's been to my talk has heard me talk about Reddit land and how Reddit land sets this what kind of very strategic plan out, and it doesn't work for everybody. And if you follow that very strict plan, odds are you're going to miss these opportunities and offshoots where you could gain so much really cool experience or meet cool people. So anyway, that's what this panel is about. I'm actually hoping that I'm going to let everyone introduce themselves, and then I'm hoping you guys can just ask a lot of questions and we'll go from there. So I thought we'd start with Dr. Wright so she could explain her path, and then we'll go into the different programs if that works.
Hello, Wright. I'm a family medicine doc. I work at Providence Medical Group, which is a primary care clinic in Anchorage. And that's my full-time job. And then as a side job, I work in Seward and one of their critical access hospitals and emergency medicine. I just do a couple shifts a month for fun because you get to wear scrubs and sew up people's faces and take out fish hooks and such. So my path, again, a little non-traditional. When I was probably some of you are in undergrad, I really always wanted to be a doctor. But I was like, you're old when you get out. So you're like 30. And so my 18-year-old self was like, oh, no, that's too old. And so I wasn't ready to commit to that. I want to get married. I want to have kids. Like that was my future. So I went into advertising. I have an advertising degree. There's not too many doctors out there with a degree in advertising, but that's mine. I went to the University of Northern Arizona in Flagstaff. And so I kind of put that aside, I just, want to be a doctor, but I really wasn't ready to be committed at that time. And so I went into advertising. I did that for 18 years. And then I kind of went through a midlife crisis, I think after 9/11. I was like, I'm not doing anything for anyone. And I just really what am I going to do for the rest of my life? I worked at an ad agency and it was exciting, but I just wasn't really helping anybody. And it always came back to being a doctor. And so one of my clients in my ad agency was Providence. And so I kind of saw the marketing perspective. And one day I asked one of my clients if any of their doctors came from Alaska, and she told me about the WWAMI program. So I Googled WWAMI and I was like, this is it. This is what I'm going to do. And so I had 2 kids in diapers and I was working full time. So I put myself on a 5-year plan because I had no science at all except for geology. And so I went to UAA and I got all my pre-meds here. And so I did that for 5 years and I took a year off and took the MCAT. And then I only applied to the WWAMI program because at that time that was really my only opportunity. And I got in and I did the residency here. So I'm a family medicine doc. And that was just my master plan as a 32-year-old that decided to change her life at 32 and now I'm 53. This is my 7th year in practice. And I just really wanted to be a family medicine doc and take care of Alaskans, and that's what I'm doing. So I mostly have like a older panel, geriatrics, which I was interested in, but I do family medicine as well. So that was my crazy non-traditional path. It took me about 13 years total, and stuff. So, but and I was sitting out there just like you guys, however many years ago, just wondering if I was going to be a doctor. And if you go to the school here and you see all the WWAMI students on the wall, and I used to walk by and be like, am I gonna be on the wall? You know, I would be in physics and I just dreamed about being a doctor, and it's just a huge, huge commitment, but there's just something inside of you that you're like, you know, and I had to try, and for whatever reason, it worked out for this little 32-year-old who's now 53-year-old. So anyways, that's my crazy story. And here I am today.
Thank you. So now the rest of our panel are heads of their particular departments, and so they're going to talk about your options, and so most of these are different ways that you can gain experience in the medical field on your way to applying to medical school. So let's start down at the end and we'll work our way over.
Hello, everyone. I'm Assistant Professor Kristen Stuffler, and I'm the chair for the Health Sciences program. And we are an undergraduate degree housed within the College of Health under the Division of Population Health Sciences, so lots of different things there. But we are one of the pipeline programs for our clinical partner programs. And I really love what I do because there's so much variety in what you can do in the health sciences sector. And oftentimes folks have no idea what a health sciences degree is. In fact, that term, or those two terms are used quite a bit in high school to really mean, it's an umbrella term often and means anything in health, right? So a lot of folks are like, oh, I can get a health sciences degree and I'll do a little bit of everything. Not quite there. We focus in population health. And so what that means is, let's think about a patient. So if you are going to become a provider, let's say that you're a family practitioner and you have a patient that's smoked the last 30 years of their life, and you're unfortunately the one that's going to have to inform them that they have been diagnosed, or that their tests come back and they're being diagnosed with lung cancer. Your focus as a clinician is to think about treatment and quality of life and what do they need in that moment. But in the health sciences program, we're interested in what led to them to picking up their first cigarette, right? What, if they tried to quit along the way, why were they not able to be successful? If they, did they even have cessation programs in their community? Was smoking a social aspect of their community? So we take a look at the environments in which people live, they work, they play, they go to school. How does that impact health? So we're looking way up that stream and trying to figure out what could we change so that we don't have as many patients coming in and having to be diagnosed with lung cancer. So we look at a lot of preventive work. And so as the panel is going to share with you today, there's all sorts of different ways that you can get to medical school. So my kind of take on it is, what's the lens in which you want to arrive at medical school with, right? So even if you're going to be working with those individual patients, it's probably a good idea to have an understanding of where they came from and how that influences health. And I'll just quickly state that I know for myself, I moved up to Alaska years ago when I was a teenager, and there was a small clinic in my community. We were still on the road system, but it was still quite rural. There was a small clinic with a physician assistant, and that was it. And it's hit or miss whether or not that person was in town, because if they were out of town, there was nobody else. And it was a 2.5-hour drive to the local hospital. There was no pharmacy. There was nothing like that. And so a lot of us left that community with long-term consequences that could have been prevented. And the PA at the time, and this is nothing against that PA, but the PA's training was more emergent or more immediate needs. Like if there's a situation going on with that patient, let's fix them and let's get them off to Fairbanks or to Anchorage or to, well, Wasilla didn't have a hospital at the time, to get medical care. And so I always feel like we need to understand what happens in a community and how that impacts those health outcomes. And so that's what you would get out of the health sciences program. And we make it so that not only do you get that core public health or population health foundation, you're also going to have all of your prerequisites for any of the clinical graduate programs built into that. So it's a really good broad way of approaching your potential future as a clinician. So thank you for inviting me today.
Yeah, thank you.
So my name is Lisa Dash, and thank you for those of you that have had a chance to stop by, have personal one-on-one conversations with me. I am the program director for medical assisting. And I like to clarify that and say certified medical assistants. There is a huge difference in what our program offers. It's a certification through CMA, Certified Medical Assistant, through the WWAMI, American Association of Medical Assistants. A lot of people don't know that there's multiple levels for medical assistants, and our program provides you with the certification at the highest level. And within the state of Alaska, you have a scope of practice that you can operate under. We're blessed in the state that we are allowed to do injections so that Dr. Wright doesn't have to have somebody else give that injection. We can draw blood. We do EKGs. We do what I call CLIA wave tests. So things like urinalysis, urine pregnancy tests. So I always like it if you like science and you like investigating things. CMA, WWAMI, that's what you're doing, besides vital signs. So we are the direct line. She could talk about medical assistants, then the value of them. We are blessed in the fact that we get to spend time with our patients. We get to spend 15 to 20 minutes max getting to know our patients as those patients return. Because poor Dr. Wright, she's gonna see the patient for 5 minutes to 7 minutes, right? So it's that relationship, it's that team approach to patient care that we are best at. Our patients will tell us things because we have time to build that trust with each other. Then we can have a conversation with our provider, and they then can provide that care to their patients. So that's what a medical assistant, a certified medical assistant can do. Realistically, here within our program, we have figured out in academia that workforce development, turning students out to be professionals in the most direct manner should be our goal. So yes, we have now what we call in academia an occupational endorsement certificate. It's called an OEC. It's 29 credits. It's very direct. It gives you the education to sit for your certification exam. You can get a job with that. The majority of my students in their last semester are taking a practicum. It's 5 credits, so 240 hours. You now have the skill set and the knowledge to work in a clinic. So that's your last class. My students are hired in those clinics before they finish their practicum. Part of that is because I get to know my students. You tell me what you want to do. You tell me if it's a specialty. You tell me if it's Eagle River, if it's Kenai, if it's Anchorage, if it's Wasilla, if it's Palmer, because you want to go back and work in your community. So I partner with those clinics. So you have that relationship within your clinic, within your community. That's why most of my students get hired. The CMA, WWAMAs out of UAA, lots of acronyms there, sorry about that, are highly sought after within our community. They are the ones that are sought out. I know that there's other programs within Anchorage, but they're not as well supported. If you choose to continue your education after that OEC, the rest of the associate's degree for medical assisting is online. So then that associate's degree, those 60 credits, as Kristen talks about, it's a pathway. We've also learned that it does us no good to make students take extra classes. So we've figured out clear, clean pathways that make it easy for you. So then the question becomes, why would you want to spend extra time, effort, and energy becoming a CMA, AAMA? Because as Teresa, Lo, and Kathy, and Dr. Wright, and any provider in this room will tell you, it makes you a better provider. It makes you able to have a conversation. If you think that as a provider, you're gonna go in at this level and the rest of your team's gonna be at this level, you're wrong. Medicine has changed. Healthcare has changed. We now work as a team. If you go to the backside of Providence on the old REI, the doctor's not sitting in an office. She doesn't have her own office. She's sitting with the MA, the social worker, the pharmacist. They're working as a team. That's what we're looking for. So as a medical assistant, it allows you to be a stronger team member.
Thank you.
Hey, my name is Bridget Mayorga. I wear a couple of hats here at UAA. I originally came to UAA. I am the program director for diagnostic medical sonographer. I've been a sonographer rad tech for 30 some years. I actually am also the assistant dean for allied health, so I oversee the various allied health programs here at UAA. But the interesting thing is, when I was in high school, I wanted to go to medical school. And my mom worked at the hospital. We had lots of her friends worked at the hospital. She's like, you don't want to go work at the hospital. I'm like, yeah, I actually want to go work in the hospital. So when I went and started my associate's degree, I used to work, and I'm really going to date myself, in the radiology department on the weekends as the file clerk / darkroom tech / front desk person. And I think in my mom's mind, that was going to turn me off. I was going to see enough that was not going to be what I wanted to do. And all it did is solidify that I wanted to go into medicine. I didn't know what I wanted to do. I ended up and went to radiologic technology school. I did a 2-year, actually at the time, hospital-based radiology program. At the same time, I worked weekends in the hospital in the same department. So I lived and breathed in the imaging department. And again, was really convinced that I wanted to go to school and be a radiologist. It's what I wanted to do. And while I was there, got married and had kids. And I was like, kind of sort of like Dr. Wright. Oh, I don't know if I really have it in me to go to medical school. At the same time, got offered the opportunity to learn to do ultrasound. The radiologist that I worked for at the time said, hey, I need somebody to do ultrasound here for me. So went, learned how to do general ultrasound, abdomen, OB. Later on down the road, got offered to do cardiac and vascular. And the more I did, ultrasound is a very challenging field. Still, when all got said and done, one of the general surgeons that I worked with, he did a lot of vascular surgeries. I used to go to the OR and scrub in with him in ultrasound. He used to say to me all the time, Bridget, you should still go to medical school. It's not too late to go to medical school. And I think by that point, my kids were probably 6 and 3, and I just couldn't make that step forward. So instead, I went and got my master's in education, and I ended up here teaching. But it's interesting, within my family, everybody either works in medicine or they work in education, and I seem to be the one who does both. There are times that I think to myself, I should have gone to medical school. But there are a lot of students that I've had over the years, be it as a program director in radiologic technology or in sonography, that have started out there. I had a lot of students for rad tech, for example. They did it with the idea that they could support themselves while they went to medical school. So we, where I lived, grew up in New York, was close to a big teaching facility. And so the students would work the weekends in radiology and go finish their degrees and go to medical school at the University of Rochester. So there had quite a few students that progressed in that direction. And just a good way to start, make sure that, you know, it was actually what you wanted to do. And like I said, it didn't necessarily work the way my mom thought it was going to work, but, and then, you know, I just think there's so many different pathways to get into medicine. And I think it's really important to explore your options, what works best for you. I think there isn't necessarily any one path. I think it's all about what's here and why you want to go into medicine. I knew that I wanted to be able to somehow use my knowledge to help others. And so to me, ultrasound was the way to do that. Cardiac ultrasound is one of my favorite things to do. You know, all you gotta do is get me started on it. So I was happy with that, but you know, plenty of different pathways to go to ultimately end up where Dr. Wright is. I never knew that's what you did.
Oh, really?
So it's just kind of funny. So there's plenty of ways to end up with a career that's fulfilling to you. And medicine is, you know, again, there's a huge need for medicine and medical professionals of all kinds. Whether you start at the entry level or you just go right to medical school. I think it's really up to you. That's me.
Thank you. So we're gonna open up the open up for questions. If you have a question, we've got online people, so I might repeat it so we make sure that our online audience can hear as well. But are there any questions out there? I have lots, so if you don't, that's good. We can, but are there any questions? Yes.
For the last speaker, do you think it's too late for you to apply to medical school? Is that something?
You know, I'm 54. I'm pretty content with what I do. I feel no, I don't. As a matter of fact, I could still, if I really wanted to, probably go back to medical school. I just feel like where I am here now, I get to affect a lot of lives to help them go into the medical career. Don't know if that makes sense.
And if you didn't ask, the question was somewhere along the lines of, you know, is it too late to go back to medical school? And
I get a lot of sleepless nights as it is now, and I'm a parent, I got lots of things going on, so that, you know, if I truly wanted to, I probably still could do it. I'm happy with doing what I do.
We typically have someone over the age of 40 in almost every class.
I have students in my classes now, it's usually, there's at least one student that's in their 40s that's coming back to school and doing something, and it's what they've always wanted to do, and it's just a calling to them. It just doesn't always, the path doesn't always, it's not always a straight line.
I have very diverse students populations. I have students who are on a second career. Within the CMA.
I'll give a shout out to the CMAs. I have an amazing CMA I work with. She's such a rock star, and I hope she goes.
Is that Chelsea?
Yeah.
Oh,
When I I didn't have any medical experience at all. I mean, I did my shadowing and I worked I volunteered at the hospital, but I knew nothing. When I started my very first class, I knew nothing, and I was surrounded by people who had a lot different experiences than me. So it was like the learning curve was huge. But the people in our office, the CMAs, most of them are in nursing school, they could become PAs. So a lot of the MAs do other things. But it's a great place to learn. And like you said, it is a team. It's not like I'm the doctor. And you know, it isn't. It's just, I can't do my job without my amazing MA, and she's a super rock star. And she has so much potential. And I know I'll lose her one day to the medical field somewhere. But for her, it's just, she learned so much, and whatever she decides to go into, she's gonna have so much more knowledge base than I did when I started day one on med school. I would have liked to, and then of course the PAs have like so many hours they have to have, but in medicine, you don't really have to have any clinical experience. Obviously it looks good on your application, but we really want to know you've kind of been explored the medical field, and and you have perspective on it, and you really want to do it. And for me, I really didn't have it. I just wanted to be a doctor. So the MA program is excellent and we're always looking for amazing MAs. So, it's a great place to learn if you need a job and you may as well start there. And for the students who are applying this year and everything, a lot of them were MAs. And we have an amazing PA in our clinic, Isabel, and she was an MA. I'm sure she was an amazing MA, but it's a really good in the door place to really learn, but you pick up on so much medical knowledge, just working side by side with the providers and bringing the patients and getting to know them. So you'll know if you either want to run screaming for the door and you don't want anything to do with it, or it's just a really good exposure. So I think an MA is good. No, CMA, sorry.
We have an online question for you, Kristen, quick, and it is what job titles those with a Bachelor of Science in Public Health or Health Sciences could pursue, or what are the starting entry jobs you can get with that degree?
Oh, I love this question so much. Because it's so loaded. I will tell you, so we have two tracks in the health sciences program. We have it's called the pre-professional track, but I call it our preclinical track because it's for everyone that wants to go to a clinical program. But we also have another track, which is our health education track. And that's for folks that want to get that degree and then go immediately into the workforce to work in public health or public health education. But let's say you get your health sciences degree, you do that preclinical track, but you decide to take some time off before you go to medical school. The one question I always get is, can I work doing direct patient care? No, we're not a clinical program, so I do want to make that very clear. But we get a lot of students from the 2-year allied health programs like medical assisting or diagnostic sonography, and we're a pipeline because we do a degree completion. So you're not starting all over again to get a 4-year degree to move on. But what you can work in, and this is the tricky part, is if you were to Google or go out and look for jobs that say health sciences, you're not going to find them unless you're actually working like in a position like I do for a health sciences program. What you're going to be looking at is there's really kind of 5 areas that you work in this area. One would be doing some type of assessment. So looking at assessing what are the health issues in communities, what are the health needs of those communities, or what's the capacity for them to implement and address health issues. The other side of that is something else that you might be involved in is working specifically in developing health programs, whether that's prevention-based programs, health education-based programs, or health promotion activities, some type of health program. The other part of that is we want to make sure any of our interventions that we implement are effective. So there's the field of program evaluation. So evaluating health interventions for their effectiveness and determining what might need to be changed or what should be stopped and something else be revisited. And then the other part of this, which is a huge part, is that health education and communication. And I think that this has grown quite a bit since we've all lived through a pandemic together, which is making sure that we can take complex health information and break it down for all audience members, right? And making sure that we are providing evidence-based, factual, inclusive health education to all audiences as best as we can. So those are the areas and careers that you can get into. Job titles are going to be a wide range of things. I can tell you some of the top employers for graduates of our programs, if you go directly out in the field, is going to be the State of Alaska's Division of Public Health. Nonprofit sectors that focus on addressing health inequities or addressing food insecurities or housing insecurity in our communities. You might go into education. You might also work in employee wellness. So don't forget, like all of our fantastic folks that are out there doing the work, they also deserve to be taken care of and doing their jobs well and avoiding burnout. And so there's a whole field of employee wellness as well that we work in. So I hope that answers it.
Yeah, no, that was perfect. Thank you. Okay. It looks like we've got 5 more questions. Let's do or 5 more minutes. Let's do one more question. Sorry. I've been talking a little too much today. Okay. So one more question. Anybody have one out there?
We still have one online if you want, Shannon.
Oh, did I miss one? Okay.
Yeah, I think Alaya had a follow-up question about Kristen's Master of Science in Education.
Okay, okay, it said Kristen has an MS in education. Is that health ed? If it is, how would that compare with a master in public health?
Oh, that's a great question.
So yes, I actually have 2 masters. My first one is in health sciences, specifically with a focus in public health and human reproduction. And then the MSCD though is a master's of science, a master's of science and education, specifically in higher education administration. So I can do this work right here. But if you wanted to work in public health, your bachelor's of health sciences will absolutely allow you to get jobs in public health. But if you go into higher level positions like management positions or director level positions, a master's degree is usually highly recommended. And the Division of Population and Health Sciences does offer both a graduate certificate in public health as well as a master's degree in public health. In fact, we've had a couple students work in the MPH program while preparing to go into the WWAMI program as well, so they can have that public health background.
Thank you, guys. That was lovely. Thank you. Elida is here. I'm not sure what we have conclusions and door prizes. I suspect that the door prizes are really the big key here. But you know, I hope if nothing else, what you took away from this panel here though, really is that there really are a million ways to get to medical school or to get wherever you need to be, whether that's medical school or something else. And, you know, we've got great people here that you can reach out to and utilize your resources to find out what works best for you. So, all right.
Thank you. So let's give our panel another round of applause. Okay, and so this is now where we will part ways with our virtual summit. So Ian, I will hand the virtual summit over to you. I'm going to sign off over here on my end.
Okay, so just change my view a little bit. I'm not going to keep you here for very long at all. Go to a gallery view. Yep. Okay, so the summit's come to an end. I don't think any of you particularly want to listen to Elida giving out door prizes to the people who are in person. I'm sorry we don't have door prizes for the people who are online. Again, as I spoke with Elida, she will be sending out an email which will have the PowerPoints attached as PDFs. So you'll have that as a reference. And if you remember from the earlier exchanges in the chat, if you have questions about medical school, if you just go to the UAA webpage for pre-medical advisors, you can find my contact details. You can also find Dr. Affenbeck. That was Shannon Affenbeck speaking and hosting that last session. And you're welcome, if you have a quick question, to shoot us an email. If you want something longer, there's a link there to both of our scheduling calendars. So you can schedule an appointment just to talk to us for half an hour. And we'd be delighted to do that. And it doesn't matter what stage you're at. If you're at high school and you want advice on how best to prepare for college, if you're at college, want how best to prepare for med school, if you're in the application process and you're thinking about how to write a personal statement or how to prepare for the interview, again, we can help with all, we will try to help with all of that. So just, we're there. There's no ration on appointments. If there's a free spot, just book it. And that's, again, we both certainly have Zoom appointments. I'm currently out of state at the moment, so I only have Zoom appointments. And then Dr. Affenbeck has in-person appointments. And when I get back to Alaska, I will too. I guess, does anyone have any questions before we wrap up? Okay, I see in the chat some very nice comments. So Alaya, Caitlin, Laura, thank you for your thank yous. And I guess, Laura, just with the MCAT, I'm taking it April, just be sure to apply. And one tip for, if you're planning on taking the MCAT soon, is Dr. Affenbeck teaches our course at UAA on MCAT prep. So don't be shy about reaching out to her for some extra tips. And I think also the only other thing is, I mean, if you want to take it in April, go for it in April. But be aware that for Alaska WWAMI, there's no benefit in applying early. Our deadline isn't until later. So if April's rushed, there's no advantage in taking it in April over May over June. The time to take it is the time when you're best prepared and the material's fresh. Okay. And same for Caitlin. So good luck and reach out. And yeah, again, Dr. Affenbeck has that expertise. Don't be shy about reaching out to her for MCAT help. Okay, and fingers crossed to all of you. We'd love to have as many applicants as we can, and we'd love to help you make your applications as strong as we can. Okay, so on that note, I'll wrap up for today and I'll sign off from this session. So thank you for being here. Thank you for being engaged. Thank you for passing on questions. Question and answer sessions get pretty dull if there are no questions. And I hope I'll see you around on campus as undergrads, as medical students in the future. Thank you.
Thank you
I'll
so
log
much.
off now. Nice. Thank you, Shannon.